enough sleep, before taking an exam, because that way your mind and your brain has fully rested, and you have all the concentration and focus that you can use for really selecting all the questions. I mean, all the right answers in the questions. I usually ask the students, "How do you eat an elephant?" You know, um, who can give me the answer to that? Miss Sapna, how do you eat an elephant?
Write in a paper and eat it.
Write in a paper and eat it. That's pica. You know that, right? You know what pica is? Eating an
Yeah.
pica is a condition where people eat things that are
The
not edible.
yeah, like
Um,
soil or the
exactly,
chalk.
dirt, and some starches. Those kind of things. But is that how you eat an elephant, Mr. Ramirez? How do you eat an elephant? One step at a time, slowly. Okay, good. I like that answer. Maybe not one step at a time, but one bite at a time, right? Or slowly. True. You cannot eat the elephant or a big. I thought you would say, well, Mr. Bidat, is that an Asian elephant or an African elephant? Yeah, because there's a difference. I'm kidding. Um, but yeah, if you were presented with enormous amount of information, then it's not gonna work if you will just study the night before the examination, right? So if you have a lot of concepts and topics to cover, and then you're trying to study the entire all night long just before the examination, it's not gonna work. You're wasting your energy, you're wasting your time, and it's not good for your health. The best thing to do really is to have a good study habit, right? Prepare for the following exam, maybe 2 weeks, 3 weeks before the exam. Well, Mr. Beda, we only have 1 week to prepare. That's true, right? So in that case, and that's one of the reason also why we're giving you weekly exams, so that at least you don't have a big chunk of information that you need to prepare before the weekly exam. Now, for HESI and for NCLEX, then it's better to really prepare ahead of time, right? Read, and a lot of students will come up with their own schedule, with their own little, what they call this, itineraries, and they will say, all right, for this particular week I will study all about cardiovascular. Next week I will study all about respiratory. So at least you have your own plan, right? Especially for preparing for HESI and even NCLEX. So you have to study smarter, not harder. You don't have to study until the wee hours in the morning, burning all those midnight oils. That's not gonna work. You'll be wasting your energy, and usually you will feel sleepy in the time of the exam. So that's not very smart, right? So how do we study smarter and not harder, right? Um, in situation with which you have little or no knowledge of, you do not ignore search and study. A lot of times, if you see something, during the lecture and during your instructor's presentation, and you're not very, how they say this, familiar with the things that they were saying, or the things that was discussed, then ask questions, and at the same time, maybe do some research on that particular topic or particular term. That way, that will enhance your understanding, and you will appreciate the information that your instructor is trying to impart or trying to say. Also, concentrate on your area of weakness. I think I have mentioned this several times during our class. One of my, I mean, I love medical surgical nursing as part of, in all nursing concepts, med surg is my strong points. I can teach med surge. I know I wouldn't claim that I know everything about med surge, but I know something. I know something about med surge. In fact, that's my major in my master's degree is medical surgical nursing, and I also have. I don't know if you notice sometimes I will put part of my title as MAN CMSRN. The CMSRN is my certification as a certified medical surgical RN. And so I know that, I can contribute a little with medical surgical nursing. What I don't like is psych. I hate mental health because for some reason, some of the concepts of mental health doesn't really make sense to me. It's been centuries and we're still talking about Sigmund Freud and we're still talking about Eric Erickson's developmental theory. And to me, there should be new principles and new concepts that we should be discussing as far as mental health. So there's not a lot of development in mental health. So I don't really like that. But when I took my exam, both my local board in the Philippines and in NCLEX, I really concentrated on mental health because I know I'm weak in mental health. I don't like studying about, those defense mechanisms and communication techniques. I don't like that because to me, there's always something different with communication technique, right? But I concentrated on that, and you know what happened when I received my result for my local board in the Philippines, and same thing here with my NCLEX. The highest score that I got was actually in mental health, and not because I'm good. It's because I concentrated on that. So what I'm trying to say is that if you know that you're weak in certain concepts, then try to concentrate on that because most likely, NCLEX in particular is an adaptive exam. NCLEX uses CAT. I don't know if you're familiar with CAT. CAT or computer adaptive testing. There are three levels of questions in NCLEX: easy, medium, and hard category. Right. Usually, the computer will start with a medium category. Medium category meaning you can answer the question correctly 50% and maybe 50% incorrectly, right? If you can answer the medium category question correctly, the next question will be a little difficult compared to the first question. If you can answer the second question correctly, then the third question will be more difficult than the second question, and so on until you reach the question number 85. If you can answer all those first 85 questions correctly, then at 85 you can beat the computer. The computer will stop giving you questions. You pass the exam, right? On the other hand, if your first question was answered incorrectly, the next question that will be given to you by the computer will be less difficult than the first one. If you answer the second question incorrectly again, then the third question will be less difficult compared to the second question, and so on and so forth. And if you trailed in that, below the passing standard for 85 question, again, the computer will stop and the computer will say, well, it's obvious that you're not ready to pass the exam yet. I will not show you any more question. You need to go home and study more and then probably come back next time, right? So that's how computer adaptive testing works. Now, some of the tests that you're taking right now, like mini HESIs from Elsevier, they are somewhat similar to computer adaptive testing, but it doesn't have the logits. I don't know if it will make sense to you right now, but the NCSBN, which is the developer of NCLEX question, they uses logits in calculating, the which question has to be given to the patient and how much of a point those questions will have. And so NCLEX has been using this computer adaptive testing since 1994. And so they already fixed all the kinks, all the bugs and everything. And now it's perfect. You cannot pass NCLEX if you did not prepare for that, if you did not study and you don't have the proper preparation, right? So again, like I said, concentrate, focus, and let's talk about some of those test taking strategies. Now, how many hours do we have in a day? Well, most of you will say 24 hours, of course, 24 hours. um, what I need you to do is identify the 2 hours in a day when you are most awake, right? And try to use that in studying, use that for answering practice questions, looking at diagrams. That's how you prepare, right? You don't prepare the night before the exam, you don't prepare 2 days before the examination. It has to be on a regular basis. It has to be, you need to have that, routine as part of your uh, everyday activities of daily living. Identify a 2 hour in a day in a 24-hour period when you are most awake. Don't try to study when you're sleepy. Don't try to study when you're tired, because that's not gonna work. You're wasting your energy. You're wasting your time. Nothing will stick right here, right? Try to identify the time in the day when you are most awake. When I'm trying to study, and Dr. G can probably attest to this, because sometimes, Dr. G and I will meet, late at night or early in the morning. So if I want to study, usually I will go to bed early, and I will wake up, at 3, 4 a.m. in the morning. Why? Because I can concentrate. I have rested, and there is not a lot of activities going on, around the house at 3 or 4 a.m. in the morning, and I can really concentrate on what I'm trying to study, right? So, but that's me. Some people, they want to study before going to bed at night, and that's okay as long as you have the energy, as long as you're not sleepy, as long as you're not tired. But if you're trying to study and you're tired, and you're sleepy, mm, that's not gonna work. Just sleep. Just go to sleep, and maybe study upon waking up, right? So just 2 hours in a day. Make it a routine, part of your activities of daily living, and that's your me time. Consider that as your me time. Nobody should be disturbing you during the 2 hours. Nobody should be, calling you at the 2 hours, and turn up all your devices for social media, because again, that should be for studying your that 2 hours. If you can do more than 2 hours, good, that's better, but at least 2 hours in a day, right? As an adult learner, apply multiple sense appeal by reciting and writing what you read. So don't just practice questions. Look at diagrams. Look at statistics. Because that will enhance your understanding of the concept. Like, you know, not really sure if it was you. No, it was the BN 440. The other day, I was talking about the statistics of respiratory and cardiovascular disorders, and even the cases of COVID. And so it's uh, it's nice to look at those diagrams. It's nice to look at those statistics, because it will help you, understand why
Is it me
Hear
or
you.
the Mr. Verdad is so mute?
We lost
Yeah,
him.
hear me there.
Okay, okay.
Yeah, all
Miss,
right. So let's wait until he's coming back. I'm going to wait a minute in order to.
He's still talking, Dr. G. Maybe you can call him. He's still
Yeah.
talking.
Just
Okay. All right. Okay. Let me see. I'm going to call him right now. Uh, okay. Hey, Mr. Verdad, we cannot hear you, but you look like you still talking. Yeah, try your, yeah, no problem. So let's wait. Just let me know if we are going to just talk to the student meantime you're coming back. Thank you. Okay, let's wait a few more seconds. Mr. Verdad is most likely coming very soon. I'm just preparing my material for what is coming next. Okay, let me see. Hmm. Studies, select the topics, strategy. Okay, so I'm going to open my slides. Come on, machine. Okay, Mr. Verdad, please, you can interrupt me anytime if you can hear me, or if you can start or continue with the session. Okay, meantime, I'm going to present my screen until Mr. Verdad is coming and see. All right, so let's talk about test strategies, and I'm going to continue on what very importantly was Mr. Verdad was remarking about the test strategies, and in general, he was mentioning about how to control the stress and anxiety that can create those tests before and during the exam, and the best way to concentrate. And one of the key words that I heard from Mr. Verdad is to focus. And that is something we are going to talk in the next hour. But now, yes, we are going to, first of all, one of the things that I want to tell you when you're going to take exams, HESI or NCLEX, that one of the most important topics that NCLEX and HESI are going to consider is patient safety. Patient safety. So, but I want to ask you, tell me, what do you think is patient safety? So, what in few words? So, everybody is talking about patient safety, but what is patient safety basically, right? Patient safety, what is coming into your mind? The patient will not die, or the patient will not fall. Patient safety. So, all these considerations that the patient are not going to risk his own life. Let's put it that way. But in NCLEX, in HESI, one of the, this is a priority too, but one of the very common questions that are coming to you, and you need to keep in consideration when you are going to answer questions in HESI, in NCLEX, is the patient safety means no medical errors. No medical errors. So no errors from what they are telling is not to keep safe the patient only, but to prevent mistakes that the nurse can make and harm the patient. Okay, so NCLEX is concerned about if you will be a safe nurse. So that's why they're asking many questions about that. Always think about what option will lead to your patient to be safe. You can automatically exclude options that will put your patient in harm. All right. So whatever. So depends the question. The question is telling you what could be or what could not be. So you need to go option by option, and see which of these. And a good tip is to tell you which of these statements produce more harm on the patient. Produce more harm on the patient. Depends what is asking you. That could be the answer, for example. All right, so patient safety, the simplest definition of patient safety is the prevention of errors and adverse effects to patients associated to healthcare. All right, so I'm going to jump into these main topics that I want to take the advantage of this moment is that when you are going to take exam, I'm going to go straight. When you go to take exam, you need to read the question all the question very careful. Okay, so you need to make you how long is going to take. So when you're going to take exam, you need to strategize your time. You need to make strategies. That strategy start with the time strategy. So you need to know that NCLEX and HESI is going to give you about 1 minute and 50 seconds for question. So you need to read about 20 seconds. That is a long time, 20 seconds to read perfectly the question, and that is telling you that is your feeling at the end. You need to make a summary in your mind of what the question is. You need to trim out all the terms that are not related, or actually like distractors. We call distractors. So you need to recognize that distractors, and basically you need to focus in one thing. So there in the questions are going to follow a nursing process. If you don't notice it, the questions are following a nursing process. And the main thing that I've been telling you in the previous weeks is that you need to remember that you start your clinical history with the main complaint. So that is what you need to see. You need to look for the main complaint of the patient in the question, right? And then you will see what is the present, what is the past, what is the family history, all the relevant things, your laboratory test, exactly what we mentioned in class. And that is a way that you can actually approach a question in NCLEX. Okay, so number one, read very careful the question, very careful, and make a conclusion. So you need to be sure what they're asking the patient. So what is the main complaint of the patient, and what is asking the question. So doing this link, you will have a very solid understanding of what is the answer. And just start to think what could be the options, right? Try to figure out like, for example, if they give some medication. Now NCLEX nowadays, in the past they was doing a generic and commercial name. Nowadays they are going, now the new NCLEX, new HESI are asking, they're asking, basically mention generic drugs, generic drug. They are not using the commercial drugs, they are using the generic drug. And for that you need to be very, very, very much sure about to learn the suffix and the prefix, right? For example, beta blockers, LOL, the beta 2, all, right? So captopril, ACE inhibitors, etc. So those are actually the suffix that you need to remember for the exam, and that is a must, because if you are not comfortable for that, you probably will going to miss some few questions. Okay, try to figure out the met like by the suffix. So number two. Number three, read the answer's choice. Does anything sound life-threatening or particular harmful? Remember, ABC get first priority. So after you, how many of you, for example, how many of you taking the exam, and the first thing you're going to see is the answers, the options. Oh my God, the options, right? So how many of you are doing that? So you read the options first than the question, and that is going to create, that is a big, huge mistake, because if you read the answer first, your unconscious is going to try to read whatever you understand, right? Whatever you understand. And the option that you understand, you want that option to be the answer without reading the question. And the question is asking totally different situation. And you need to remember that these guys that create these questions are professionals doing this, and they know and they explore the weaknesses and of the students to take exams. So what they want them to know is how strong are you in your concepts. So that's why, please don't read the answers at all first. Take your time strategy about 20 seconds, 25, 20 seconds to read the question and actually understand the question. Then, and after that, you need to go to the options. Remember safety suffix. So what are the options that produce more risk to the patient? Okay, what is the option that probably put more in dangerous the patient? That is something that you need to remember always. Okay, all right. So then you have don't pick nauseous, for example. This is don't pick nauseous, vomiting, and diarrhea. Okay, because in pharmacology, basically all all drugs are going to be causing nausea, vomiting, and diarrhea. All drugs. So one of the most common side effects is what we call the big three. Big three. Remember we was talking that big three. Remember or no? Somebody? Hello.
Yes.
Yeah.
The big three is nauseous, vomiting, and diarrhea. So unless the patient has some problems of blood in the feces, it could be dysentery, many reasons, could be Crohn's disease, many other problems, and you need to be very careful with that. So, but in general, they're not going to ask you. They're not going to waste their time. They don't waste one question to ask you something that is too basic. That every drug is going, all drugs basically can produce nausea, vomiting, and diarrhea. All right, so in young or elderly patients, so you need to identify. So one thing that is important in pharmacology is that the patient, if this is young patient or is an elderly patient, so it's a big difference. You know the changes that we have during age, right? So the functions of the liver, the functions of the kidney. Obviously, a kidney is not going to work as when you were 20 years old, when you right now you're 70, right? Or the kids are not going to, probably if they are too young, they're not basically develop completely the kidneys and or the liver, and that is something you need to keep in consideration. In pharmacology, to go straight to the point, the drugs need to be the dose important for elderly and young people, because the metabolism that is happening in the liver is different, and the excretion by the kidneys is going to be more difficult in kids and elderly people. So you need to be careful into always check your LFTs and Chem7. You know, Chem7, you know that very well already, right? All right. So then we have most of the medications, most of all the medications they can be taken with meals. So 5 and 6. Usually you take medication with meals. So this is going to be 15 minutes are going to be the suggestions about that. Take bronchodilators before steroids. We already talked about that. Take bronchodilators before steroids. That is always, I put it here because it's always, I see that in Hesi and NCLEX. Never stop a medication abruptly. Another thing, never stop a medication abruptly. Because that can produce a rebound effect in many of these treatments. All right, so just before that, I want to mention a few things. Okay, so we agree now that the first thing you're going to do when you're going to take your exam is to read the question very much. So then you're going to have a conclusion about that question. So what they're asking, because there are many options that are true, but they are not related to the question. So you need to be very extra careful in order not to make that mistake. Now, one more thing I want to tell you. I want you to read option by option, option by option, option by option. Don't jump from option to option. Go to one first option, and this is and that is going to help you for select all that apply. So you know how you can make easy select all that apply? You can make it easier to select all that apply. How? Just to think that instead to have one question, you have 5 questions. So that is like five questions in one, right? So you need, and actually in the new NCLEX and new HESI, I will say that mostly the majority of the options are the answers. I noticed that there is no like one answer in multiple answers. It could be more than three or four answers from out of five. So that is a trend that I can see and notice into HESI and NCLEX. So you need to go option by option and say this option is true or is false. This option is true or false. The second option is true or false. The third option, etc., until you get to the five options. Then you will have your false and true, and you can start selecting what could be the best answer. One more thing I want to tell you about the select or the apply. So when you think about something, the first answer is the best. Statistically, there are some people who are second answer, but they're not the majority. The majority or the bulk of people who answer test question are going to be first answers is the best answer. So is if you go like 50-50%, you keep changing, that is going to make you actually decrease your grades very much. So please, try to educate yourself, force yourself. I know that these tests are testing your insecurities of everyone, not of only few, but for everyone. Not everyone. Do you think if I take an exam, I'm going to have 100? No, the last time I was taking HESI, I was having very high 99, but actually I couldn't reach the 100% that I was upset. But what I can do, that is true, right? So why? Because lack of focus or whatever, right? So we are going to talk that in the next hour about that. All right, so I want to make a substance about this is this. When you know that you are in risk to change your right answer that you have previously, is this. And this is poison, please. So listen to this, please. You start to think, okay, this option is okay. Oh, this option. And then you start to say, what if? That is the moment is telling you red flag, alarm, stop there. So you're doing in the wrong direction. You're creating a bias. If you start to think, what if? Oh, but I'm not sure. I I but I'm not sure. What if? So that is the moment you need to stop yourself, freeze yourself, and go back to what you were thinking previously. So those are the recommendations in order to take multiple choice or multiple answers. Okay, so always and take your time. Don't rush. So those I can see people who are taking the exam in 10 minutes, 15 minutes, 20 minutes. And I can assure you, based on the experience I've been seeing students taking exam for many years, is that at least if you take the full time of your exam, if you're very fast and you take your full time of the exam, you are going to basically improve 30% at least of your overall grade if you take your time and you follow these steps. Okay? Is Mr. Verdad here?
Yes, Dr. G, I'm here.
Mr.
Sorry.
Verdad, I'm sorry.
No, 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 it's fine. I was that's nice.
Okay.
I apologize for that. I was kicked out in the meeting room from the meeting room. Um. Anyway. Yeah. How many more minutes do we have? We only have 10 more minutes. So.
Yes, Mr. Verdad. I'm sorry. You
Um.
tell me. I didn't know you were here. I was.
No, 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 no. That's fine. Uh, just and I was listening to your discussion, and that was really good. Especially for NCLEX exam. And do you want me to just use the next 10 minutes?
Yeah,
We
please,
can.
please, please, Mr. Verdad.
All right. Okay. Guys, I'm really sorry. For some reason, my presentation computer. I don't know what happened. So if I can present my screen again, Dr. G.
Oh, yeah, sure, sure. Yeah.
Okay.
Mr. Vela, you can take the next 5 minutes, 10 minutes more, so you can probably be until 9:40 if you want.
Okay.
Because we have the break, we can take the break. Just granted.
Okay. Thank you. Thank you. All right. So let me just continue what I was explaining earlier. So we were talking about how to study smarter, and this will be good not just for NCLEX preparation or HESI preparation, but for your weekly exam as well. Because some students will say, "Well, Mr. Burdett, before we can take the NCLEX or the HESI, we need to pass the weekly exams first," and that's true, right? So my suggestion is this: when you're studying for your weekly exam, and a good habit again will help you build that what you call this test taking strategy, so that it will be part of your DNA, it will be part of your practice, right? So the first tip that I want to share with you is that when you're looking at the question, when you're uh, trying to pass a test, make sure you're not approaching the exam believing that the questions are tricky. There are no tricks in NCLEX. There are no tricks in HESI. And I saw one of the slides for Dr. G. He said that one of the goal of NCLEX is to see whether a candidate, like a student nurse taking the exam, can practice safe and effective nursing at the entry level, not at the CCU level, not at the operating room, emergency room type of nurse, but at the entry level, meaning questions in NCLEX and even on HASI are just questions that you know uh, no prudent nurse will put patients in an unsafe environment or unsafe situation. So everything about the NCLEX and about HASI is basically checking or assessing whether a candidate can practice safe and effective nursing, right, at the entry level, that you will not provide the wrong medication to the wrong patient, and that you know how to calculate the right dose of medication that will have to be administered to the patient, and you wouldn't do things that any prudent nurse, or is that the right term? Yeah, you wouldn't do things that any prudent nurse will not do. So those are the basic understanding that you need to remember for NCLEX and for HESI, right? And so all of these strategies can help you even with your weekly exam. Do not approach the exam thinking that, oh, there's a trick to this. No, there's no trick. It's just basically asking you or assessing whether you will choose the option that will provide the most the safety or safe nursing intervention and effective nursing and intervention for your patient, that you will not harm the patient and you will not kill the patient, right? So also in NCLEX and in HASI, remember, this is basically the utopia of nursing. In NCLEX and in HASI world, this is the perfect world of nursing. It's not the type of world that you will see in real world. Like if you go to your clinical sites or to your place of work, and you're seeing some practices that are not supposed to be done, or there are a lot of nurses, if you're working with them, already what they call this, form their survival skills at the bedside, especially those nurses who've been working at the bedside for quite a while. They already develop some survival skills, and if you look at them, those are not necessarily the ideal practice. And so if you're answering question in NCLEX and in HESI, don't use the things that you're seeing at the in your place of work, or in your clinical sites, because some of them may not be the ideal situation. So use the principles in textbooks, use the principles that we have, in our classroom discussions, because those are the perfect world of nursing, right? In the world of HESI and in the world of NCLEX, you don't have problem with staffing. You have all the staff in the world, and you have all the personnel in the world that can help you with providing the quality type of care that you need to provide to the patient. In the world of NCLEX and in the world of HESI, you don't have problem with the time. You don't have time constraints. You have all the time to sit with the patient, listen to the patient, and and provide the type of communication that the patient needs, right? In the world of NCLEX, you don't have problem with supplies. You have all the supplies that you need. You have all your PPEs. So what I'm trying to say is that when you're looking at the question for NCLEX and HESI, use the perfect world of HESI, use the perfect world of NCLEX, because you cannot use your experience at the bedside, because some of the things that you will see is not, of course, the perfect scenario. And look for the answers that will let the exam writers know the client is in safe hands. And again, like I said, and Dr. G emphasized this, it's all about providing safe and effective nursing care to your patient, right? And that's all there is to it, to NCLEX. If you can provide safe and effective nursing to your patient, there is no doubt that you will pass NCLEX. You will never go wrong if that's the thing that you have in your mind, right? A lot of NCLEX question, HESI questions pertains to basic, common, and general, principles, general knowledge, not critical care. There will be no question in NCLEX how to insert an endotracheal tube. That's not part of our, that's not part of our scope of practice. That's critical care. They will not ask you about arterial line. They will not ask you about intracardiac or intraosseous medication. That's not part of basic vocational nursing scope of practice. Those are critical care. So don't worry about those things. Those are nice to know, but again, try to focus on the basic and general knowledge and general concepts rather than those critical concepts. Right. In NCLEX, also there is only one correct answer. I know in some instances. During the review of tests, sometimes they'll say, "Well, Mr. Verdad, the other option is correct too, or the other option is correct too," and that's okay during undergraduate studies, right? And we can actually allow that. But in NCLEX, there is only one and only one correct answer. All of those questions pass through rigorous assessment of all content experts, and so, if they say one is the most correct, then only one is the most correct, unless it's a select all that apply, of course. If you find it, you just keep it. Don't convince yourself to choose another. Don't change your answer in HESI or in NCLEX, right? Unless you're sure that you misread the question in the first place, right? Because a lot of students are trying to convince themselves, oh, there might be another answer, there might be a second, this is not supposed to be this easy, right? If you find the answer, stick with it. Don't try to convince yourself that there is something better, or another option is much better. Usually your first instinct is usually the best instinct, your gut feeling. So again, don't change your answer unless you're sure that you misread the question in the first place, right? Anytime the age is given in a question, pay attention to that. Why? Because it's usually significant. It's usually important. Why is that? Because a therapeutic regimen or a nursing intervention that you will provide to a 70-year-old patient will be entirely different from the nursing care that you will provide to a toddler or to an infant. So anytime the age is given, pay attention to that. That's usually significant, right? Anytime the time is given, pay attention to that. That's significant. Like for instance, if a regular insulin was administered at 0700, when will you provide the meal tray of the patient? So that is significant. If the patient came in at let's say 1500 in the emergency room, and the patient is complaining of chest pain, why is that significant? That time. So the time will not be provided in the question unless it's significant or it's important in a question. So pay attention to those keywords, right? Again, one strategy that you have to remember, you have to distinguish all the information provided for you. Remember, all the information that will be provided in the question are necessary to answer the question, right? So pay attention to those informations. You just jail the detail, meaning just focus on the detail that's provided, and don't worry about the flops. Sometimes I think Dr. G mentioned something about distractors earlier. Yeah, those are the trash. Don't worry about those. Don't pay attention to the trash. Just pay attention to the details, right? A lot of times they will provide distractors in a question, and distractors are supposed to distract you from choosing the right option. So make sure that you can identify the trash, right? Now I want you to understand the anatomy of an NCLEX question or a HESI question, right? This is the components of a question, the normal anatomy of a question in NCLEX, right? Usually, a question will provide you with a case scenario right here, right? And a case scenario will provide you with critical elements or keywords like who is the patient in the question, what is the issue in the question, and what is the issue, and what can you do, what are the information that you need to use, like keywords, for example. And then after providing you with a case scenario, you will be given a STEM. This is what we call a STEM right here. Like, which of the following nursing action provides for the client's safety? The STEM is the actual question, and the STEM has something to do with the information that's presented to you in the case scenario, right? And then after, and there are two types of STEM: a STEM that will ask you the right option, and the STEM that will ask you for the wrong option that will make it right for the question. So um, I will explain later those two types. And then after that, you will be given four options. And you have to remember, right, in a four option question, 25% of the time you are correct, right? So the best thing that you could do in a four option question, in a multiple choice question, is make sure to eliminate those options that are obviously incorrect, because if you can eliminate one obviously incorrect option, that increases your chance of getting the correct option from 25% to 33%. If you can immediately eliminate two obviously incorrect option, then 50% of the time you're correct, right? So by using process of elimination, you can increase your chance of getting the correct option by just simply identifying incorrect options and using that to increase your chance of getting the correct ones. Also pay attention to the four critical elements in a question. Again, the keywords: who the client is, what is the issue in the question, and you need to identify what kind of stem you're dealing with, because that's really, really important. Like keywords like early or late manifestations. If you see those keywords like early or late manifestations, pay attention to that. Why? Because the answer will significantly change based on the keywords. Why? Early signs would be entirely different from late manifestations, right? So early signs of shock, for example, versus late manifestation of shock. Those are two exactly opposite, pathophysiologic event, right? Early signs of shock will probably give you a tachycardia, an increase in an increase in the blood pressure, and an increase in respiratory rate, right? But a late manifestation of shock is exactly the opposite when all the compensatory mechanism has been utilized. So pay attention to those, right? Like early manifestation of asthma will be entirely different from a late manifestation of asthma attack. Like in the early stage of asthma attack, you wouldn't see respiratory acidosis because the patient will be trying to compensate by increasing the respiratory rate. So most likely in the early manifestation of asthma, you will see respiratory alkalosis rather than respiratory acidosis. But that is different from a late manifestation of asthma because again, those compensatory mechanism has been exhausted already. Early manifestation of, let's say, for example, compartment syndrome will be entirely different from the late manifestations of compartment syndrome. So pay attention to those keywords because it will give you a good idea what type of question or what type of answer you need to provide, right? And then keywords like most likely or least likely. A lot of students are getting confused with that. When you say most likely, then it means that all the other options in the question are potentially correct. But which one is most likely to happen based on the uh, information provided to you in the case scenario? So again, most likely and least likely, those are two opposite, keywords. Least likely, of course, is exactly the opposite of the most likely thing to happen, right? Initial nursing action. So if you see this, and I think sometimes I'm emphasizing this during our review of exams. If you see questions like initial nursing action, then it means that you're dealing with a prioritization question. It means that all the options provided will be correct. It's just that which of these correct options should you do first or initially. And I always emphasize, always think about independent nursing action first before choosing collaborative and dependent nursing action. Sometimes I will provide a question, which of the following should be done by the patient by the nurse first, and I will put some high polluting, options like take the EKG of the patient, administer morphine sulfate if the patient has chest pain or shortness of breath, but which of the following should be done initially by the nurse? Well, again, initial nursing action should be your independent nursing action first. Things that you can do independently without relying on doctor's order or without relying on uh, the other team members, help. So it has to be done like just simply positioning the patient comfortably, right? Before even administering the oxygen, before even taking the vital signs of the patient, you need to make sure that the patient is comfortable first, because that patient will not cooperate if the patient is not comfortable. If the patient is having shortness of breath and it feels like they feel like this is the end of the line for them, do you think they will care about your vital signs? They won't. If they're having severe chest pain and you're trying to get the EKG, do you think they care about your EKG if they feel like this is the end of the line for me? No, they have to be comfortable first before doing anything, further. After several days, of course, that's another keyword. And I'm sorry, I know there is not much time on the day of admission. So just some examples, right, of some questions right here. The nurse in the emergency department cares for a client diagnosed with possible cervical spinal cord injury. It is most important for the nurse to assess for which of the following. So I want you to pay attention to that keyword, most important, right? So it means that among the options, this is a prioritization question, obviously. Among the option, which one do you think is the most important nursing interventions or nursing assessment rather that you have to do for the patient before doing anything else? Anybody? Miss Guevara,
C.
You would check
you would
what's
choose you would choose C. Yes, that's true, because it doesn't matter what the neurologic function of the patient is, or the pre-existing medical condition and how the accident occurred. If the patient is not breathing or the patient doesn't have pulse rate, right? So again, in terms of prioritization, it's important to know our principles. ABCs. We have the Maslow's hierarchy of needs. We have nursing process, right? If it is a nursing process question, then you cannot do any intervention unless you assess. And since this is a prioritization question, ABC, you have to check the airway of the patient, check whether the patient's breathing before doing anything else, right?
Mhm.
So yes, that's true. Another is, who is the client? You have to identify who the client is, because again, like I said, I told you the age of the client, and the client in the scenario will give you the right, it will tell you which one is the right option, because again, there's a big difference between an older client versus a younger client, especially in case of dehydration, for example. Just Dr. G, just a couple of slides, so they will not miss this. I'll give some examples of this. Is the type of stem that I was telling you about. There are two types of stem in NCLEX and HESI question, either a true response stem or a false response stem. A true response stem will require you to provide an accurate explanation or choose the right answer, and a false response stem will ask you which one is wrong. Like for instance, stem like which of the following statement by the patient indicates that the patient requires further explanation? That is a false response time, meaning you need to choose the wrong option that will make it right for the question, right? Or which of the following suggests that the patient needs further understanding? Those are false response time, and you need to be careful with that, because I heard Dr. G saying earlier, don't look at the option first without fully understanding what the question is really asking. Because if you look at the options first without fully understanding what the question is asking, you will miss some of the false response time. And if you see an option that talks about familiar things, then it is more likely that you will choose or pick that option because it's familiar to you, without realizing that the question is really asking for the wrong option that will make it right for the question, right? So pay attention to that. And these are some of the true response time. And I could probably provide this to Dr. G, and Dr. G will share this with you, right? And I have false response time, like keywords like inappropriate, like this, right? Um, and these are some of the destructors that Dr. G mentioned earlier. If two options say the same thing or include the same idea in a question, then neither of these options can be correct, right? So if you have two options, like if somebody asks you which of the following should be the primary assessment that the nurse needs to do for the patient, um, check the vital signs, check the check for tachycardia, check for increased heart rate, check for temperature of the patient, then you know that the tachycardia and the heart rate are two options that say the same thing, or has will provides the same idea. So neither of those options could be correct, right? So you have to pay attention to that. Now, let's look at this example right here. In providing care to a client with COPD, the primary nursing consideration is two. Let's look, do we have similar distractors here? Those options that say the same thing. Mr. Romero, can you identify the similar distractors before giving me your answer?
Wait, what was that? I couldn't really hear you.
We're looking for similar distractors, right? Options that say the same thing or this provides you with the same idea. Miss Guevara, can you tell me which of the options are giving me the same idea?
A, B, and D.
A, B, and D, right? Not overtire the client, plan adequate rest periods, allow the client to set the pace when walking. All of these options are telling you that provide certain, rest periods for the patient. They're giving you all the same idea. Only option C is telling you that with COPD, give only low flow oxygen because the patient most likely will stop breathing if you provide high flow oxygen. But A, B, and D are giving you the same idea, so neither of these options could be correct, because if I choose B, then what's the difference between B and D? It's telling you the same thing. Allow the client to set the pace when walking, plan adequate rest period, don't overtire the client. It's all the same thing. So only C would be the best, right? Uh, Here's another one. A client with upper respiratory infection tells the nurse, I'm so angry with the nurse practitioner because he would not give me any antibiotics. What would be the most accurate response by the nurse? Who can tell me which options are similar distractors or giving you the same idea? Mr. Ramirez. I know Mr. Ramirez is here. I saw his name earlier. What do you think?
I would say, I mean, both A and D have antibiotic, and they're even B.
Mm-hmm.
They all have that phrase antibiotic.
But are they all giving you the same idea? Look at the statement of the patient, right? I'm so angry with the nurse practitioner because he would not give me any antibiotics, right? And what would be your response? Now, if you look at C and D, right? Let me talk to him and see what we can do. I agree with you on D. You do need an antibiotic. So these two, C and D, are implying that you're agreeing with the patient, right? That he does need the antibiotics. Now, B, why do you think you need an antibiotic? That's a very inappropriate response, because if you say, why do you think you need an antibiotic? You're whying, and that puts the patient in a defensive mode, and you will not get the response of the patient properly. Because if you ask me, why do you think you need an antibiotic? It's like you're challenging me, and so therefore I have to put up a defensive mode, and so you won't be able to explore my feelings, right? But C and D are giving me the same idea. Let me talk to him and see what we can do. It means that you're agreeing with me if I'm the patient, right? That I do need an antibiotic. And then D, I agree with you, you do need an antibiotic. But A is telling you, hey, antibiotics have no effect on viruses, which is true. You don't need antibiotics if it is a viral infection, because antibiotics will definitely not. So it's a factual information that you can provide to the patient, right? So the best answer here would be A, because that's a simple response. That's a factual response, right? So, but C and D, those are what we call similar distractors, and you have to drop them immediately if you see them. Um, so I guess that's all I have, Dr. G. I know I exceeded the time, but I can provide this to you,
Yeah.
and you can share this with the students. Just again, another word of caution: if you see some absolute terms or sweeping statements in a question, most likely those are incorrect options, because there is very little things in this world that are absolute. There will always be an exception to every rule. So if you say, impossible or nothing every like every day, I mean, how can you exercise every day? That's not realistic. Or nothing can be done, or it's always be cautious with those keyword, I mean, with those absolute words, because it means that there is no exception to the rule. Okay. All right. I guess
Thank
some of
you.
this I can discuss this with you once you reach VN 440. For you guys, it's almost next module. We're like 4 weeks away from module 4, and after that, we can you will have your VN 440, and we can talk about some of this test taking strategy in the beginning of VN 440 as well. Thank you, Dr. G. Thank you, guys. Again,
Thank you,
happy
Mr. Rab.
Sunday to all of you, and enjoy the boot camp. Dr. G, I'll be monitoring, and if you need me, just
Yeah,
call me. All right. Thank
absolutely. Thank you, Mr. Rab. It was very interesting, and I'm sure that they want to have a second part about this.
you. Yeah, sure, no problem. All right. Thank you. Bye bye.
Thank you. Bye. Okay, guys. All right. So we are. It's 9:53. We are a little bit behind the schedule. So I will try to catch up with the next topic. So the break is passing. I'm sorry, but I think it was worth it. Mr. Verdad was having very accurate and very straight information. And let's start talking about the test anxiety management. So after that, I'm trying to finish a little bit trying to catch up time, and I want you to have three flashcards, and I want you to bring your radio or put some music that I going to give you. What are the tools that we are going to use for our next activity? So let's start. So, okay, so let's talk about test taking anxiety. Okay, so when you are taking a test, you see that you will have it's a very high pressure situation.
Dr.
So,
G, sharing your
yes,
screen.
oh, okay. Can you see me?
Yes, thank you.
Okay, so talking about test and taking anxiety. So everybody has some level of anxiety. Stress is good, anxiety is good, it's bad. So when is that happening? So basically, we need to make a frame about that and how to control that. So I'm not going to be able to explain elaborate too much because the time is short and we want to have a timing for other activities. So when you are taking the exam, you're going to be in high pressure. The high pressure will be before the exam and during the exam. Okay, so but tell me, do you need stress? You need anxiety? Yes, is all our life are going to be certain level of stress and some certain level of anxiety. Anxiety is okay, but because that is life. Life is not everything that everything that you expect to happen. So there's always the unexpected things that are going to happen, and that creates some anxiety. The problem is that the anxiety at the beginning is not a disease, but can produce a disease. When anxiety is turning into make you be dysfunctional, you cannot be productive, you cannot do the activities that you usually do every day. That anxiety needs already a treatment, so it's already some pathological presentation. But anxiety, we have anxiety every day, we have stress every day. And just to make short, stress is something that you can change. Stress is something that you can change. So if you have any problem, you know what to do to resolve. That is stress. But anxiety is you have a problem, but you do not know how to resolve. You said, I don't know what is going to happen. I don't know what is going to happen. I don't know what will be. So that is anxiety. Okay. All right. So that is what we call the difference between stress and anxiety. So you want to differentiate that between stress and anxiety. Some students before the exam they have stress. Some is a certain level of anxiety. Other students they have stress, but much more level of anxiety, and that is how we're going to try to talk about that. So what is anxiety? Anxiety is the fear for the unknown. So see yourself in the taking the exam. The opposite of what could be anxiety is you feel comfortable. You feel comfortable. You feel that actually like fish in the water, like I'm ready for the exam. And the sort of positive in this situation is to think, I will pass this exam. I will pass this exam, but I want to be sure. I'm telling you, if I don't pass this exam, I if I don't, I will not understand why I didn't pass the exam, because I study hard on this, and to know that you study appropriately, correctly, we need to follow some steps that I'm going to show you later. Lack of preparation, fear of inadequacy. So lack of preparation. So that is timing. Timing management. So you need to study at least 3 days, 3 times before you take your exam. 3 times, 3 days before you take the exam minimum. Negativity, fear for fail. You start to think about my family, my friends, my everybody passing in the class, but I'm not passing. What about if this happen? So you have these distractors in your mind. So if you get rid of that before the exam, you are going to have a more positive attitude towards the exam, and that is going to create confidence on you. So if you get rid of all these ideas or fears of fail, that why they're doing better than I, why, so don't try to do that. So try to do in positive thoughts. So we are going to see that in a few moments. So this anxiety that we already know is the fear for the unknown. Okay, actually we can turn in something positive that make us comfortable. That is the opposite of anxiety, and that is how we can get that. We can get with positive thoughts. Anxiety physically is going to affect your performance. So anxiety will affect you physically, emotionally, and what is the worst is the cognitive area, physically, emotionally, and cognitive. So how is we are going to talk about physically. So, but physically, I will tell you ahead of time. Physically, you're going to stay in fight or flight stage. So fight or flight. So you start to have your heart rate go up, your respiratory go up. Everything is, you start to sweat. You have tremors, physical, and that is taking you away even more to be focusing what you are actually need to focus in your exam. Emotionally, you start to feel down. You start to feel nervous. You start to feel this fear that actually make you think that you're going to fail, and you want to pass the exam fast. So I want to take the exam very fast in order to not suffer from this stress. So those are basically mechanisms of defenses. Mechanism of defenses. We are going to see that. Cognitive. What is happening with anxiety? Listen, what is happening with anxiety? You lose your focusing. You cannot focus if you get anxious, because you are in fight or flight. You want to survive. You don't want really actually to take your time to resolve a problem. So you need to you fight or flight is run away, fight, kick, jump, go out of the situation. And that is basically the affecting your cognitive level. Okay, when anxiety begins to interfere with your daily life, it may be anxiety disorder. So that means treatment. But anxiety is every day. You have anxiety because you don't know, but you can resolve that in a few moments. But if this unknown is going to last for many days, many weeks, even months, that are going to give you some problems to be functional in your daily life. Like when you're anxious, your body goes into fight or flight mode. So those adrenaline, this cortisol are going to go up. Why? Because you need more glucose in fight or flight, the cortisol levels, right? Cortisol, the adrenaline levels, so heart rate and all the vital signs that is going to go up. What to do? Recreate, simulate an exam when you study. That is one of the techniques that you need to you need to see at home, is to try to recreate one exam that are going to be similar. If you can, it's recommended to be in the same classroom to try to recreate exams and questions. You can do it yourself, or you can do it with other students, study group, like a play, like somebody play the teacher, play the instructor, or play the student, and actually play stress. That's what I always recommend in order to make the simulation, so you're getting familiar with the situation. So at the time that you're taking the exam, your level of stress are going down. Physically, we have all the components that I just mentioned. Emotionally, you have a feeling of worthless, feeling of helpless, panic, panic attacks, even feeling of dangers, flashbacks. So that means what happened if. So in the past, what happened that. So my family, I see my father, my mother, my every telling me you're failing or whatever. Forget about that. So that is going to take you away from you to get focused into your exam. Cognitive difficulties of concentration. That is what is happening. All this anxiety, all these negative thoughts, all these negative thoughts that you have before to take the exam are going to affect your cognitive level. So difficult concentrating, anticipating worse outcomes. So how familiar is that, right? Mind often going blank. You blank your mind. And who is that? Anxiety. And it's because you didn't study? No, because you couldn't handle your stress, your anxiety level before the exam. So this is just to show you how you can handle that. So first of all, you're going to in the next activity, I want you to have 3 pieces of paper, a small paper, and I want 2 pieces of paper. In one paper, tell me, write down 3 things that are making you have negative thoughts before the exam. And in the other paper, I want you to write down 3 positive things that make you feel hope, to feel energetic, that to do more things. Okay, so and those you need to explore what are those reasons. Okay, how do you know you have negative thoughts? So do you have negative thoughts? Do you know that? Somebody said, I don't care, I don't know, but that negative thoughts need to be changed, because if you are you are a person with negative thoughts, that is definitely is going to take you to fail the course, the exam. So I will say, I want to know what I should do not to fail the exam. But right now I'm going to tell you what you need to do to fail that exam. So what do you need to do to fail the exam? Number one is to have negative thoughts. And how do you know you have negative thoughts? If you see everybody around blaming other people, complaining, and to be ungrateful. So there's 3 things that actually we need to remember. Blaming is a mechanism of defense. So I don't accept my errors. I don't accept my errors. I I don't manage my time because somebody's fault. So I didn't study because somebody's fault. I didn't do this or that because it's not my fault. It's somebody else's fault. When you do that, you really you need to think about what you're saying, because this is life, and blaming others for what's happened with you is a mechanism of defense. What is a mechanism of defense? Mechanism of defense is to make you feel better, to make you feel that you are correct, that you are not making a mistake, because you love yourself. Everybody loves himself. So everybody loves himself, and you don't want to blame yourself that you are guilty, because that is make you feel basically that guilty, and you don't want that. So you are blaming other people. That is projection of a mechanism of defense. So that is a negative pathway. Complaining, helpless, hopeless, and victimized. So you victimize yourself. You're victimizing yourself. You're victimizing yourself. I didn't study because of this. So I didn't study because of the other one. So I have so much things to do. I have this and that. Complaining. So complaining is letting you into negative thoughts. So how much are you doing this around when you are doing your program? So ungrateful. You expect more from others. So you expect that others are going to make the job from you. So it's not how much others can help you, but it's how much yourself can help yourself. So these three things, if you change all these, you will have a very positive attitude into the exam. And most likely, this is no NASA, there is no any, going to other planet science. It's not rocket science. It's difficult, but definitely you need to change all this mindsetting, the mindset that you have about the program, about the course, about your test, about your exam. Okay, so what negative thoughts you have before an exam? Failing an exam focusing on negative thoughts will make you fail the exam. I want you to write down for the next activity. We are going to try to have 5 minutes break in the next few minutes, and I want you to write down, please, 3 negative things that you always fear. You must do your most secrets. I mean, in the most deeply secrets you have, put it right down in that paper. What are the 3 things that make you afraid to make? That is part of the activity. So please, positive thoughts turn negative thoughts into positive thoughts. Write down 3 positive thoughts. I want you to write down 3 positive thoughts of what is making you feel that energy, injection of hope, injection of wishing to do more things. It could be a family, could be your son, could be the daughter, could be something, right, that is injecting that energy, and that is a positive source. So that is the reason what you're doing in this school. How to change negative to positive? Focus in your goals. Focus in your goals. So that is the key word. How we can change our negative into positive. Focus in your goals. My goal is this. I want to. There's at the level of professional and human being goals. So what you are looking for, at least at the end, you're looking for happiness, right? And this happiness should need to be shared happiness. So that is one of the best goals. How do you reach that happiness? Sharing happiness with others is just doing what you need to do. Pass your NCLEX, be good professional, study in the right way, don't make shortcuts. That is actually one of the principles, right? That actually you're building on blocks, layers during the time. Don't focus in daily, difficult, present, or past. So that are distractors. So I have a broken tire, or I have to pay the bill or whatever. Don't think about that. Just you can, when you're taking before the exam or you taking the exam, don't think about anything of these problems. So that's why I recommend you. So please, if you have, for example, the very common kids that they need to do to the daycare, you need to have plan A, plan B, and plan C. 3 plans. If plan A doesn't fail, it doesn't work, you have a phone call and say, okay, we agree with that. So talk ahead of time, right? To create less stress. And you know what? Probably it's going to help you this. But if you are the more stressed you are, the more older you become, faster. So don't get older, please. So just anticipate situations that are going to make you plan A, plan B, plan C, and you will see your life is going to be much more easier. Strategize, efficient study time, how to study, time management. Another time I'm going to talk about that. So I would like to talk about sleep. You need to sleep. You need to sleep as much as you can, at least 6 hours, 7 hours. Try to sleep not so late. 10 o'clock would be the maximum time that you can be, because you study when you are sleeping. Your memory, your brain is regenerating during the nighttime. And whatever you learn, your brain start to keep elaborating and analyzing. It's taking a time of processing all this information. And the lack of sleep, what is going to happen is that process is going to be interrupted, and you cannot incorporate into your mind. Okay, so sleep is very important. So exercises too. Exercise. So who has time for exercise? Yeah, do some exercises. Just walk 1 mile or half an hour or 20 minutes just to distract yourself. Why exercises? Because exercises are going to increase what we call the endorphins. Endorphins is um, a type of opioid that we have naturally produced in our brain, and that is making you the threshold for pain and are going to be higher. So that means that you enjoy, so your dopamine is going to be higher if you do activities outdoors. Dopamine, endorphins, your mood is going to make higher, so better. And what happens, you sleep better. So everything is going to be related to when you are going to eat. When you eat, please don't eat a lot of carbs. Don't eat a lot of carbs. High content of carbs are going to be really, really bad. Why? Because when you have high levels of carbs, the carbs are going to when you finish to eat, they are going to in your body, and then they are going to drop. When they drop abruptly because the high content of carbs, you start to get into signs and symptoms of hypoglycemia. You feel tired, you feel sleepy, you feel like you don't want to focus and you don't want to concentrate, and that you don't want that happen during the exam. Okay, so very nice breakfast, no high in carbs. Okay. Okay, create a routine, steps, decrease stress, anxiety. So if you have results from one way of the one way to you have a good exam, good grade, repeat the same steps. Prepare, elaborate, and that is not forever. It's going to be, I mean, you can create a lifestyle on this, but in these 2 years that you have, in 1 year and a half that you have in this program, try to program, and you will see that is going to create a style of life on you. So you can, and you're going to be a nerd for the rest of your life. So the nurse is very organized. We know that very well. And that is when you're going to get that here in the school. You start to get that here. So when you're going to get it, until you get a nurse, no, doesn't appear like magic. That is something that you is coming naturally from you. Otherwise, it's just not realistic to think that you're going to be a nurse. I'm going to be very organized at that moment. Not now because I'm still in the school. No, no, no. That is coming. That is going to be created from the very, very beginning. Okay, so relax. So with this, I'm going to finish this. There's many others that I want to talk, but there's a slides already. Three slides. Okay. So what to do here during the exam? That is before the exam, but during the exam, during the exam, during the exam, what you're going to do is to have 3 big deep breathing. Breathing in, wait 2-3 seconds, and then breathe out. So what does that mean? So what they are doing that? So 3 times. Then you're going to do this. You're going to contract your muscle. Contract your muscles. Sitting, contract your muscle. All the muscles of your body. All your muscles of your body. And for 3 seconds. And then relax all the muscles simultaneously. What is doing this situation? Not everybody is doing that, but it's recommended to do that. Is to the breathing process. What is going to happen is to increase the oxygenation to your tissue. The muscles are going to contract and relax. They are going to reactivate the blood circulation. And what happened with the breathing? When you have a deep breathing, your heart rate start to go down. See, remember the physical manifestations of anxiety or stress before the exam, fight or flight, increased heart rate. So the breathing, your more oxygenation, that is going to put your heart to beat slower, and actually because you're receiving more oxygen into your body. So all this tachycardia, palpitations, sweating are going to be away if you do that before exams. Okay, so I would like to talk more about that, but definitely, yeah. So no cramming. Study ahead of time, 3 days, 3 times. Okay, and that is about. All right, so thank you. What time is 10:17? Oh my God, I'm totally way off on my time. All right, so can we have a week? Okay, so I need to improvise. 10:17, so 10:20, 18:23. Can we come back at 10:23, please?
Sounds good, Dr. G.
Yes,
Okay,
thank
so one
you.
more thing, see, please. I want you to bring a. We are going to take a test exam that is going to be in Moodle. But in this case, I want you to bring a radio. I want you to be totally distracted, totally distracted. So this exam is going to be 15 minutes. I want you to stand up. I want to walk. Is you want to talk to somebody, you want, but you have only 15 minutes for this exam, 1 minute per question, and then I will proceed with the next activity. Okay, so I want to make the difference between when you are distracted versus when you are not distracted. Okay, so I will see you at 10:23, and everybody is going to get ready for Moodle. In Moodle, it's going to be exam number 3. So I'm going to show my screen. Everybody can start. You can turn down your speakers. Please, I would like you to make noise. I would like you to talk. I would like you to jump. I would like to listen music. I want to make whatever. I want you to take the exam totally distracted. That is going to be the first activity, and I will see you at 10:23. Any question, please?
No question,
No
Dr.
questions for
Thank you.
All right.
No,
So I will see
thank
you then.
you.
Take care. Hello.
Hello, Dr.
G.
Okay.
G.
Are you ready with your music? I want you to put music. I put to just stand up. I want you to do think about all the negative things that you have in this exam. Okay. So I'm going to share my screen. I'm presenting. I'm going to Moodle, please. I'm going to Moodle, and I'm going to go to pharmacology. Everybody going to Moodle, please. And where is this? Pharmacology. You go here to your online course here. We are going to have the test. We are going to take this HESI test. Okay. So before you get there, I'm going to put the music louder. So what kind of music you hate? Or you don't like it? Let's put it. I don't know which one. Crazy music. And don't. All right. So I don't know what is that.
Because Dr. G, it's expired.
Got something to say or sell?
Is
Constant
expire?
Contact's powerful.
What is expire?
The quiz.
Expire? Oh yeah, because of the time. I was putting the time. All right, so I'm going to check the time here. Timing. Okay. Okay. Now refresh, please. You refresh? You see?
It worked.
Okay. Now you need a password, right?
Yes.
Yeah. Okay. So I'm going to put the music, and then please try to stand up, go do whatever you doing wrong, or whatever you want to do wrong, do wrong. Okay. So that is your time.
Online marketing tools make it easy to stand out.
Okay. That is disco. That is very out of date. But anyhow. All right. So I hate that song. All right. So what I want you to do is this. Are you ready with the password?
Yes.
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 We are
All
not
right.
ready, Dr. G.
All right. So let's start. The password is the number 1. Only put 1 and you get in. Are you in?
Yes.
Okay, go ahead, please.
Crazy music, crazy music, crazy people, crazy people, crazy music, crazy music, crazy people,
Dr. B?
crazy people. Each time you start to dance, I bet you were dancing my heart.
Dr. G, can you turn on the music? It's distracting me, Dr. G. I can't take my test.
What?
It's distracting me, the music. Thank you. I can't take the test like that, Dr. G.
That is the idea. That is the idea. That is the idea. Go ahead. Keep going.
Thank you, Dr. G.
Okay.
You're driving me insane. I'm crazy about you, baby. Crazy music, crazy music, crazy people, crazy people, crazy music, crazy music, crazy people, crazy people. So baby, be aware. There's tension in the air. Take care of you. Take care of you. Don't let it get too hot. For there's no way to stop the passion inside my heart. Crazy music, crazy music, crazy people, crazy people, crazy music, crazy music, crazy people, crazy people. Oh, 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 oh. sign is better than. I get into a dress and my heart's on fire. My heart's on fire. Don't let it get too hot. Oh, there's no way to stop the passion inside my heart. Crazy music, crazy music, crazy people, crazy people, crazy music, crazy music, crazy people, crazy people, crazy music, crazy music, crazy people, crazy people, crazy music, crazy music, crazy people, crazy people. Oh, 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 yeah, 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 yeah. Oh, 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 yeah, yeah, oh yeah, oh yeah, oh yeah, oh yeah, oh yeah, na 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 na. Hey, 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 na 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 na. Crazy music, crazy music, crazy people. This is that ice cold Michelle fight for that white gold. This one for them hood girls, them good girls, straight masterpieces. Stylin', wildin', living it up in the city. Got Chuck's on with Saint Laurent. Gotta kiss myself, I'm so pretty. I'm too hot. Call the police and the fireman. I'm too hot. Make a dragon want to retire, man. I'm too hot. Say my name, you know who I am. I'm too hot. And my band about that money, break it down. Girl, said you hallelujah. Girl, said you hallelujah. Girl, said you hallelujah. Cause Uptown Funk don't give it to you. Cause Uptown Funk don't give it to you. Cause Uptown Funk don't give it to you. Saturday night and we in the spot. Don't believe me, just watch. Don't believe me, just watch.
You know what's going on. You need to go to Hesitate Anxiety 1. You got it up?
Don't believe me, just watch. Don't believe me, just watch. Hey, hey,
Okay.
hey, oh.
One is the number, it's not the letters. Huh?
Sign the check.
The number one.
Get the stretch. Right to Harlem, Hollywood, Jackson, Mississippi. If we show up, we gon' show out. Smoother than a fresh drop skipping. I'm too hot. Call the police and the fireman. I'm too hot. Make a dragon wanna retire, man. I'm too hot. Bitch, say my name, you know who I am. I'm too hot. And my band about that money, break it down. Girl, said you hallelujah. Girl, said you hallelujah. Girl, said you hallelujah. Cause Uptown Funk don't give it to you. Cause Uptown Funk don't give it to you.
So just wait until so try to keep it clear. Okay,
don't believe me, just watch. 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 Hey, 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 oh!
Number on my credit card is 0237-1221-0725-0211.
gon' give it to you. Give it up, I'm gon' give it to you. Give it up, I'm gon' give it to you. Say that I'm ready in the spot. Say that you just got that.
Terminator, electrician, roofer, installer. Don't take that everybody. It's everybody. I can pick up a few prices, but before I like on the atmosphere, so anytime for break or one base out, I know.
Well, I guess the fortune teller's right. Will it be just what was there and not some holy light? Now, I don't care, I have no luck, I don't miss it all that much. There's just so many things I can't touch, I'm torn. I'm not afraid. Good night, I'll make it on the floor. Illusions never change into something real. Wide awake and I can see the perfect rhinestone. Oh, little light, one more at a time. Oh, shit, yeah. I found Midnight that does that, sorry. I haven't changed it. So if you do more than 3 emotes, okay. Lols.
I'm out on it because I went through this in my head. Who's their better option?
Pink Sweat.
Like, look, I'm gonna be blunt. I think
Get wrecked, Buzzwalk.
I think
Lols.
but I think Casey Rudolph.
Card 2.
Tell me who finished already, please.
About Mac and Jones, whoever they're gonna find.
You still taking the
I think if you're
done?
the Steelers, yeah, you figure it out. You create some cap space. You keep him. You let him ride out into the sunset as a Steeler. Because I don't know that there's any solution they have that could all of a sudden make them a Super Bowl team. Look, the reality is they started 11-0 last year. But Carm, you and I sat on this podcast every week, and every turn we're like, yeah, they're really not that good. Like it's an unbelievable run. Give them credit, they're 11-0. At some point here, this thing's coming to roost, and it did, and we didn't win a playoff game. So I look at Pittsburgh, and I see a good team that's about to lose a lot of guys in free agency.
Looking to recession-proof your career and start earning as much as 6 figures? Hack Reactor has industry-leading coding boot camps to fit your needs and do it in as little as 12 weeks. To learn more and apply, visit hackreactor.com.
Ever look at your home and want to change everything?
Kelly Oubre got in, clogged up the roll, closed back out, helped him recover. Wiggins, that's a nice Oubre. Here at 30, start win. Washington missed it. Mellow ball is a great. Mellow ball, you see that ball hopping around?
Can I call you baby? Can you be my friend? Can you be my lover up until the
right down the lane.
Let me show you love.
Ball. He did not.
Okay.
Wiggins attacking. And Andrew Wiggins, he'll pick.
Okay, so everybody finished, or we still taking the exam?
I'm done. I'm done, but we failed really bad.
Miguel.
Okay, all right, perfect. Okay, excellent.
Miguel.
Right. What? Miguel? What is that? Okay. All right, so everybody finish, please. I want everybody to finish now. Please finish now.
Yes.
Stress. Everybody got it, right? Everybody, please. Rebecca, you finish?
Yes, I finished.
Okay, please, lady.
Yeah, I just finished.
Okay, Joel.
I'm done.
Okay. All right. So perfect. Everybody's done now. I want you to go now to quiz number 2 and test anxiety number 2. In this situation, you're not going to have any distractor at all. You're not going to have any distraction. So have a deep breath 3 times and actually relax yourself. Contract your muscles 1, 2, 3, and then relax. Okay, so there is no rush. So everything, try to bring up your positive thoughts, your goals.
It's
What?
expired too, Dr. G.
Yeah, it's expiring. Okay, so I'm going to do that. Just a moment. And this time there is no noise. I want you to focus as much as you can. Okay, and the refresh your page, please. Refresh your page. You okay? We are ready?
Yes.
Yes, for the password.
They're asking for a password. Okay, the password is the number, only just one number, 2. There's no letters. It's 2. Who is in, please?
I am.
Okay, perfect. So no noises. Everybody focus. Take your time. Okay, you have 15 minutes. So I'm not going to talk. I'm going to block my microphone. Please relax and take your exam. Thank you.
Sorry, Dr. G, what was the password?
Yes, 2. 2, the number 2.
I cannot hear you.
Number 2, Sabna. 2.
Dr. G, what was the password?
Number 2, Sabna.
Okay, thank you.
I will appreciate if you put in your in the chat that you finish in order not to interrupt the rest. Please put in your chat you finish to know how many of you are finishing already. Okay, everybody's done with the exam. Tell me very brief because we have behind the schedule, but anyhow. So, Miss Rebecca, how was it?
It was better than the first one for sure.
Lady, thank you.
Definitely better than the first one as well.
Joel,
I actually did better on the first one, but yeah.
you did better than the first one.
I did better on the first one as
Yeah.
well.
Okay, Sabna,
Yes, Dr. G, same.
same what? Same the first second best than the first.
The first one better than the second one.
Okay, Claudia,
I did a little bit better on the second one.
Anila,
Yes, little bit better on the second one.
Ishmael,
I did better on the first one.
Montserrat,
I did better on the second one.
Miguel,
I did slightly better on the second one.
Cyril.
I did better on the second one, Dr. G.
Thank you. Kim,
I can't get in on the first one, so I don't know what to say on the first one, but I'm okay with the second one.
okay, Kim. Krisa,
Better on the second one, Dr. G.
thank you. Cheyenne
I did better on the second one.
and Ruby.
Same here. I did slightly better on the second one.
Okay, so all right, if you see here, there is some mixed results here. Yeah, so Fidel, Joel, and who is Miss Sabna? Yeah, okay, so they out of 15, 3 we are having the results. So the conclusion about this, what could be a conclusion here, Miss Rebecca?
All right, can you repeat that? My daughter was screaming.
No, what I'm saying, what could be a conclusion about this dynamic, these two tests?
Most of us will work better without distractions.
Yeah, so definitely, and if you add there your positive thoughts and get away from the negative thoughts and be prepared for the exam, your confidence are going to be much higher. For example, when I want to tell you this, when I see a student studying 1 minute, 2 minutes before the exam, 1 minute or 2 minutes before the exam, that is telling me that that student is not confident. Make sense or no? And these confidence are going to make the student actually have some not best results for the exam. So for that, you need to do your strategy, not only during the exam, but before the exam. Study three times, all the topics that we are talking, and I'm sure that you will have good results. So that is in conclusion. So in conclusion, what we have is that distractors, negative thoughts, the mind setting of the exam is important to cope our stress or anxiety test. Okay, so there's more exercises. I can create another time, different exercises besides this, and I will actually share with you when is the time. Okay, any question?
No.
Was a good dynamic. Do you like it or you don't like it? So probably you didn't like the dynamic. I would like to hear if there is no comments. That means that everybody agree with the dynamic. You okay with that?
Yes.
Okay with it.
Okay, I'm passing attendance, by the way. So we are going to finish at 11:30. 11:30 is going to be, we are going to catch up we are going to do review of skeletal pharmacology topics. Then after that, we will have a break of 10 minutes, and then we are going to start doing our super slide contest, number 1. That is going to last 50 minutes, and then lunch. And then after that, we have another sequence of super slide contest, and then the mnemonic. See, and yeah, so let's start with our next topic will be review of selected pharmacology topics. Any question?
No.
Can you see my screen?
Yes.
Okay. The review pharmacological topics, selected topics, is based on previous theses from previous groups, where Miss Christy Matthews was helping me to identify the areas of weakness of the HESI, and that was very good, really, and I really need to thank you her for his dedicated work. And yeah, so that's what I identify. And one of the issues, no issues, but weakest areas was the gastrointestinal system. So, all right, so those are the topics that I have on my NCLEX review. I'm not going to talk about all of them, but this is basically what is NCLEX and HESI. But today we are going to talk about the anti-acid, anti-H2, PPI, coating agent, prostaglandins, and the prokinetic. Okay, all right. So the first is going to be, what are these guys? Remember these arrows? We are talking about gastrointestinal drugs. Especially when you talk about gastritis, PUD. Remember? So what is gastritis, by the way? Everybody can tell me what is gastritis? Somebody?
Inflammation of the GI.
Inflammation of the GI. So gastritis is an increase of gastric acid in the stomach. Increase of gastric acid in the stomach. Okay? Increase gastric acid. What is GERD? What is GERD? See? What is GERD?
Gastrointestinal, esophageal, or
This is very common.
help me, guys.
Acid reflux.
Yeah.
Gastroesophageal.
Esophageal.
Right? So that is GERD. Gastritis is increase of gastric acid in the stomach, right? Gastritis. GERD is the gastroesophageal reflux disease, where you have the esophagus, we have the stomach, and what happened, the sphincter is relaxed. So the gastric acid is going to get into the esophagus. That is going to lead into pyrosis. Remember pyrosis? What is pyrosis?
The acid reflux, heartburn.
It's a heartburn, correct? Perfect. So another term, what is PUD?
Peptic ulcer disease.
Give me examples of PUDs. Where are the PUDs?
Pylori area and duodenum. Yeah.
Duodenum and the stomach. Any place that you have the ulcers or lesions on the stomach or in the duodenum, that is called PUD. We okay with that?
Yes.
So, all right. So, what is a gastrointestinal upset? What is a stomach upset? So, I have a stomach upset. What do you mean? What are you thinking about? I have got the patient's having gastrointestinal upset. So, what are you thinking about?
Flutters, pain, probably diarrhea.
Yes. So, a stomach upset means whatever is not normal is going to be a stomach upset. You have too much. You have a distended abdomen because of gas in the stomach. That is actually stomach upset. You have actually these burns, gastritis. Can go in this category. GERD is going to be in this category. So stomach upset and GI upset is when you have any of the gastrointestinal levels, swallowing, for example, or diarrhea or constipation. That is going to be generally a gastrointestinal upset. That is basically the terminology that the people use, not the patients are using. So, but you need to translate that into medical terms. Okay? So for this, we are going to see the drugs that are going to be used for these problems. Okay, so these arrows means that there are two arrows are neutralizing. So the first drugs that we are going to talk is are going to be the antacids. Then we have an arrow going down. The arrow going down, those are actually the drugs that are going to decrease the production. That's why the arrow is down. Decrease production. PPI is the protein pump. Proton pump inhibitor. I always make mistake. Proton pump inhibitor. Why proton? What is proton? What is a proton?
Proton is the hydrogen alone when they are in a lot of
yes,
together in bulk amount, it creates
So
an acid.
Excellent, very good. So you know the hydrogen have one proton and one electron, right? So plus one minus one is zero, so zero charge. But the hydrogen is going to lose the electron, and what is remaining are the protons. So that's why it's proton positive. Is actually an hydrogen. Okay, so that is acid. Then the other one is going up. Which is going up is the production of mucus. That is the prostaglandins. So how many we have already? We have 3 groups and 1, 2, 3, 4 subgroups of medication. Then we have here the coating agent is going to surround the coating agent. The coating agent are going to be the sucralfate. We are going to see that in a few moments. And the prokinetics. Prokinetics is going to be everything crazy. So not crazy. It's going to produce the motility. So prokinetics is the metoclopramide. Is a dopamine antagonist. And as a dopamine antagonist, I tell you ahead of time, they can produce pseudo-Parkinsonism. Okay, so we will see that now. Antacids. Antacids are going to neutralize acid, acting, but do not last long. So just remember that, please. So here we have antacids, we have Alka-Seltzer, milk magnesium, Amphogel, Tums or Rolates. So neutralize acids, fast acting, but do not last longer. Take first medications, and after 1 hour, or sorry, after 1 hour, no, before 1 hour. This is need to be corrected. Before 1 hour and or after 2 hours. So it's going to be 1 hour AC or 2 hours PC. 1 hour before meals or 2 hours after meals. Okay, so never mix medications with these antacids because the absorption is going to be diminished. You need to avoid acid. So for NCLEX, HESI, you need to remember that we have some triggers that are going to increase the gastric acid. What are those triggers? And that I'm mentioning that because it's important, because NCLEX, I like to talk about that. What are the triggers for increased gastric acid? Everybody, please.
Smoke.
Smoke. Coffee. What else?
Alcohol. Yeah.
Alcohol. What else?
Spices. Yeah.
Spices.
Spicy food.
Spicy food. What else? Yeah. So basic chocolate. Okay. So those are need to be prevented by the patient. If you smoke, for example, there is many NCLEX equations that is going to diminish the effectiveness of the medication. Obviously, right? Because gastric acid is going to produce more gastric acid if you smoke. Okay? All right, so not in heart failure, not in recent myocardial infarctions. Basically, this because that is in general for all these drugs for gastric acid. So what is going to happen is basically these medications have high content of sodium. Why they have sodium inside? Because that is going to help the absorption on the mucus. So they just think about the pharmacy is thinking about just to decrease the gastric acid. They don't think about other situations. If you have myocardial infarction recently or heart failure, you will have that these have high content of sodium that reabsorbs water, and that is going to increase the cardiac output. Okay, increasing the cardiac output are going to increase the preload and going to increase the afterload. The need of oxygen for the heart is going to increase. So that you need to prevent that, please. Okay. Sodium bicarbonate, antacids, we have the Alka-Seltzer. As you can see, its side effect is going to be the metabolic alkalosis. Bicarbonate is alkaline. Taking bicarbonate, you're going to have this metabolic alkalosis, okay? Alkalosis. All right, so magnesium milk, magnesium. Magnesium produces diarrhea. If you remember here this chart, remember this? Remember this? Okay. Magnesium in this side, right? If you give too much magnesium, the magnesium cannot go out because there is too much magnesium outside the cell. So what they're going to do, magnesium, is to prolongate, make longer the rest of the muscle. So that is going to lead you to have, for example, you feel tired, you feel drowsy. Magnesium can be produce drowsiness. And magnesium is going to decrease the reflex. The patella, the knee reflex are going to be diminished. I will tell you ahead of time. Right now, the reflex is going to be like this. If you hit the knee, it's going to be like this. But when you have toxic levels of magnesium, the reflex is going to be slow. It's going to be slow. So that is telling you that you have toxic levels of magnesium. Antidote for this will be the calcium gluconate. Calcium gluconate. Calcium gluconate. Calcium gluconate. Okay, so don't forget that. That is a HESI. So And I'm saying that because in HESI, in the previous HESI, they was failing this type of questions. So that's why I want to remark that most likely, I don't know what is coming in HESI, but definitely it's very likely that they can be repeat these questions, okay? And there's no exactly the same questions, but there are different questions, but talking about the same topic. All right, so magnesium, another thing that you need to remember, is very hard for the kidney to get rid of magnesium. So please, if you have kidney problem, ARF, that means acute renal failure, or any alteration of the kidney function, is contraindicated to give magnesium in this case. You okay with that?
Yes.
Aluminum is the amphogyl, is the constipation, produce constipation. Calcium carbonate, Tums Rollates. This is one of the most that can produce rebound hyperacidity. So you need to take it like 4, 5, 6 times a day, these Tums. And what happened is that this is a very fast effect, but it's going to be a very short period of time. So you need to take it again and again. Calcium, CC, constipation. So which ones are going to cause constipation? Aluminum and calcium. Side effect, open eyes, open ears, is coming for the exam, okay? For HESI, most likely. Rebound hyperacidity is characteristic from calcium carbonate. Tums, Rollates, rebound hyperacidity. Of course, if you have kidney stones, if you have supplement of calcium, that is calcium carbonate, that can produce the acceleration of the formation of or enlargement of the stones on the kidney. All right, so we okay with that neutralizing. So what they're doing is to neutralize. They're going to neutralize the acidity. So that's why we have bicarbonate. Okay, bicarbonate. We have here carbonate that is a weak base. Aluminum, magnesium. So all of these are going to increase the neutralize, are going to neutralize. That's why it's called antacid. Anti-H2. Remember, H1 is for the rest of the body. The receptors H1, the histamine, right? But this is H2. How do you remember it's from the stomach? Because you said H-stomach. H-stomach. Okay, to stomach. Okay, so H2 are receptors that are located in the stomach that are going to produce the more gastric acid. So what they're going to do is to block these receptors, and they're going to decrease the gastric acid. So we have the suffix for this is the tidine, otidine, cimetidine, ranitidine, famotidine. Cimetidine, ranitidine, famotidine is so common that you need to remember the name of the commercial names. Cimetidine, Tagamet, ranitidine, Santac, famotidine, pepside. So give me a second, please. Okay. So we have tidine, so cimetidine, ranitidine, famotidine. So this should be given 30 minutes before meals. 30 minutes before meals. 30 minutes before meals. Okay. So these antacids you can take it at any time. So you can take it any time. They are going to be at least you need to take it like 2 or 3 times, 4 times a day. Anti-H2, 30 minutes before meals. Dizziness, drowsiness. So I want you to pay attention to this. The H2 is family to H1. H1 is when you block antihistaminics, you're blocking H1. So H1 produce drowsiness, yes or no? Right?
Yes.
All right. So this is a cousin. Is his cousin. It's very close. So they have the same nose, the same mouth, the same ears, but not exactly the same. So they have similar characteristics. So this H2, what is going to do, produces drowsiness too. So be careful with that. Okay. So all these LOC, they can happen: dizziness, drowsiness, headache, confusion, deorientation. Okay. So anti-H2, these ranitidine, cimetidine, famotidine are going to decrease the absorption of the antifungals, HESI. Okay, smoke can interfere with absorption of H2. So smoke is if you have gastritis or you have increase of gastric acid, please don't smoke, because that is going to even increase more gastric acid, and that can increase your risk for PUDs. Thrombocytopenia has been reported in ranitidine and famotidine. Thrombocytopenia. Thrombocytopenia. Thrombocytopenia means it's going to be, for example, platelets, right? What are the normal levels of platelets? 150,000 to 140,000, correct? Yes or no?
Yes.
Yeah. So you have ecchymosis when you have less than 150,000. And you have purpura, we talked about that in previous class, purpura or petechias, when it's less than 50,000. So this is worse than this. Okay, so small dots appear in the skin is worse than big bruises that you have in ecchymosis. Okay, I want just to think about cimetidine. Cimetidine is, this drug can produce gynecomastia. Gynecomastia means enlarged of breast. In male, you know, this normal breast, you see these people were 300 pounds, 400 pounds. You see the breast look like a breast, right?
Yes.
No. Right? So how we differentiate the normal breast tissue from gynecomastia? Gynecomastia, the breast will be like a rubbery. At the palpation, the breast is like a rubbery. It's more harder. Meantime, the normal could be by fat, or could be a normal growth, could be much more soft. But you have the sensation of rubbery that is telling you gynecomastia, and cimetidine will be one of the side effects. Cimetidine can produce impotence, so that means erectile dysfunction. Okay, and that cimetidine is not used so often as before, but ranitidine is used. The first drugs appears in the market were the neutralizers, the aluminum, magnesium, etc. Those are the first one. Then appears like a boom, like a, wow, they said everybody will resolve the problem. Appears the cimetidine, the Tagamet. But then appears the ranitidine, and the famotidine appears later. So famotidine is going to last more time than cimetidine, basically. Okay, cimetidine is not used as before because of these problems of gynecomastia. Okay, so we have decreased. Now we have the other type that decrease the gastric acid. We have the anti-H2. Now we are talking about the PPI, decrease the acid. You need to remember prazole, omeprazole, osemeprazole, prazole, 30 minutes before meals. That is the same as the previous one. So to decrease the gastric acid with anti-H1 or PPI, you need to take it 30 minutes before meals. All right, so this is one of the most common, or the most effective to prevent ulcers. So it's used for ulcers prophylaxis. So when somebody is going to go to the UCI, to the intensive use, how you call intensive unit care, right? The intensive unit care unit, intensive
ICU.
ICU. Exactly. So, for example, these people are going to be used prophylaxis of a PPI, because nobody likes to go to this area. It's very stressful, and that can produce ulcers of stress ulcers. So that's why in the first 24 hours, the patient are going to receive this PPI. So this PPI, and you don't need to go to the intensive unit care unit necessary, but in general, in order to prevent ulcers, are going to be used the PPI. The PPI, what is the problem with the PPI is they can contribute for osteoporosis. They can contribute to osteoporosis. So you need to have regular bone density tests. Osteoporosis is very high yield for NCLEX. PPI is used when you are having H. pylori, the Helicobacter pylori, omeprazole and clarithromycin. Clarithromycin, what kind of drug is that? What is clarithromycin?
Antibiotic.
Antibiotic, and that is what? Macrolides, right? Romycin, clarithromycin. That is for Helicobacter pylori. Helicobacter pylori. Increase the levels of warfarin, phenytoin, and benzodiazepines. So when you take PPI, they can reach, you can have toxic levels of warfarin, or you can have toxic level of phenytoin. Phenytoin, what it's going to do is used for as AED, anti-epileptic drug, or anti-seizure. Phenytoin, we are going to talk more in detail next classes, but phenytoin can produce gingival hyperplasia. So the gingiva become very swollen and red. Benzodiazepines are tranquilizers. Okay, so you know what? Some people take tranquilizers before the exam. That is not a healthy way to handle a stress test. So to take some benz, you're going to sleep in the middle of that. You feel tired. You feel actually not slow, at least during the exam. So I do not recommend to take benzodiazepines. So PPI are going to increase the levels of effect of the benzodiazepines and basically, yes. So you need to remember that this PPI, okay, so like a summary, PPI are going to really make a problem with the anticoagulants, anti-epileptics, and the tranquilizers. Coating agent, prokinetic, and prostaglandin we are going to see now. Coating agent is the sucralfate. Coating agent, sucralfate, constipation. Okay, a calcium carbonate are going to be a neutralizer, constipation. Aluminum, constipation. Coating agent, sucralfate, constipation. Those are very high yield for your exam. Prostaglandins, the misoprostol, is contraindicated in pregnancies. Why? Misoprostol is going to increase the levels of prostaglandins that increase the risk for uterine contraction, uterine contraction, especially in the first trimester. Prokinetic is the metoclopramide, is the extrapyramidal symptoms. Extrapyramidal symptoms is the same to say pseudo Parkinsonism, or to say Parkinsonism alone, Parkinsonism. So that is telling you extrapyramidal symptoms, pseudo-Parkinsonism or Parkinsonism is the same. So why? Because the prokinetic, the metoclopramide are going to be dopamine antagonists. These dopamine antagonists are going to decrease the dopamine levels and produce the pseudo or extrapyramidal syndromes of Parkinson. That is going to go away as when you stop the medication. All right, so we have side effects: metabolic alkalosis, sodium bicarbonate, constipation, aluminum sucralfate, diarrhea, PPI. PPI and magnesium can produce diarrhea, and rebound hyperactivity, calcium carbonate. So that is already 11:30. I'm going to pass attendance. There is much more that I was trying to go review with you, but basically we need to catch up with the calendar. We can use that. I will highly suggest to read this PowerPoint that I posted in Moodle. You okay with that?
Yes.
Yes.
Please
Yes.
promise you're going to do it, right? Promise?
Yes.
Yes, promise.
Yeah, I spent a lot of time creating that again. So please use it, okay? Take advantage of that. So right now, I'm going to pass attendance. We have 19 students. So 19. Somebody came in addition? Somebody
I
just
did.
came?
This is
Altia?
Althea, Dr. G. Yeah, I came in late because I didn't get a link.
Okay, Altia. All right, so I'm going to consider you are coming in. You, okay, so you're going to start in break number 3. All right, so where is Altia? I lost you. Okay. All right, perfect. All right, so we have, according to the calendar, we are going to follow the calendar. We have until 11:40 break, and then we are going to talk about the Super Slides Contest 1. Okay, so for that, I'm going to prepare in this break. I'm going to show you my screen. You can take your break. Meantime, I'm going to organize the groups. Who is asking first? Who is asking second? The one who is asking are going to create a question. I'm going to tell you group A to group B, group C, group whatever group. So everybody need to be ready with a set of questions. So if the other group are actually not able to answer your question in 30 seconds, the point is going to go to your group, to the group who make the question. So if you cannot answer, that is point for me. In other words. But if you answer, that you give me 0 points to me. You okay with that?
Yes.
You were only asking one question, right? At a time?
No, one question at a time, and the other group will reply to you. So we have 100 minutes to that. So probably we can have 2 rounds or 3 rounds. So you have probably 2-3 questions, 2-3 questions, and you're going to be having 2-3 answers. Okay, so but everybody's going to have the same number of opportunities. You okay with that?
Yes.
Okay, perfect. So now I will see you in 7 minutes. I will start doing the to sort out the groups. Okay, break 3.
Yeah, can we go on break now?
Yeah. You have 6 minutes now. 11:40. We coming back at 11:40.
Okay, thank you.
Okay. Okay, so let's see here. What?
Dr. G?
Yes.
I think I'm gonna go now, Dr. G. Thank you.
Thank you for coming. Thank you so much for coming. Okay. I was inviting some people from group 6364 as observers only. Okay, so you see here, can you see the groups? We have group A, B, C, D, E, F. So I make all the possible combinations and I'm going to randomize now. So I'm going to randomize. So this is the number correspond to that. Okay, so now I'm going to randomize. Okay, so I'm going to print out this for me in order to have a list of activities. I mean, to keep a track on that. Okay, so that is the group.
Dr. G.
Oh,
Hold on.
oh. Oh my God, yes. What
Hi,
happened?
this is Cyril. Question: how many questions do you want us to make for these questionnaires? I'm
Yeah.
confused.
It could be, okay, I will tell you. For example, the first group is going to ask C to G.
C to
Okay?
G.
So you have, if everybody is, depends how fast we are going to do this simulation. This,
Oh, I see. So
yeah.
it's like
So
throwing back questions.
So I finish this, and then I'm going to randomize again.
Okay,
So,
I got it.
Yeah. So
Thank you.
sure. I'm going to print it out in order to follow. Huh? Okay, I have my paper coming.
Dr. G, do we just ask random questions?
You need to be ready with a bunch of questions. That is part of your prep before the activity. Okay, so now we are going to start in 2 minutes. So
Dr. G.
Yes, Krisa.
This is Krista. I'm kind of having a hard time because I'm all by myself. No, none of my. I mean, I think I expressed this to you, but to come up with, I think, 12 questions and answer the other group all by myself, kind of a little tough for me.
Okay, so listen. Well, yeah, that is you, Krisa. Yes, where are you? Oh, Krisa, you are the only one. So yes, the other 3 didn't come, right? So that is going to be, yeah. Well, yeah, that is life. I guess, Krisa. Sorry.
No problem. Thank you.
So, but yeah. So, but you are not going to be in disadvantage to anybody because you are. It's an average. An average. Second, I would like to use somebody in the group, for example, group A. I would like to have Corpus, Kimberly, the lead. So somebody need to answer, okay, fast. I would like you to have the lead to organize that. Krisa, you are the only group. Ruby, Altia is in the other group. I want you to take the lead there to answer. If not, other ones can take the lead, but I don't want confusion to answer. It's only 30 seconds, by the way. There's a group E that didn't come today at all, and we have a group F that is going to increase our chances to do more questions, by the way. Anila.
Yes, I'm here.
Okay, so you are the sign there, and Claudia. Okay, are we ready? I'm going to count the time myself, so 30 seconds. If everybody can help me to count 30 seconds because I need to do it like more than 40 times. So yes, help me with that, please. Okay, I'm going to have my watch here.
So Dr. G, you only want the team leader to answer for the group?
Yeah, if the answer if the team leader doesn't answer because you are not in the same place. So you need to have a connection with chat, meeting, and that takes some few seconds, right? So let's see how is that going. Okay, so let's see, because this is the first time I'm doing this. I don't know how we are going to, but let's elaborate. All right, so now let's start with question number 1. Question number 1, we have group C. Group C that is going to ask question for group G. So group C is Ruby Guevara, and G is Claudia Orellana. So your question, please. Ruby.
Oh, sorry. Are we going first?
Yeah.
Okay.
So please. Okay. Ruby, can you ask the question to group G? That is Claudia, Miguel, and Sabna.
Okay. Let me see. I'm communicating with my group.
So depends how fast we are doing that. We have more options to do more questions.
Okay. And you said, I mean, it's completely up to us what questions to ask, right?
Yeah.
And what type, or does it have to be just
Can
multiple choice?
Can you everybody put the camera, please? Because I don't want to read charts. So questions should be already memorized. So please, everybody, camera, please. Altia, Claudia. Oh, yes. It's your boy.
Dr. G, it's
Sorry.
my camera is loading. Sorry, I'm trying to work it as fast as. Oh, there you go.
Ishmael. Okay. So let's see. All right. So C versus G. Okay. So the question. Go ahead.
Okay. So our question will be, the nurse knows that these drugs will cause tinnitus. And the choices will be A, ketorolac, B, quinidine, C, furosemide, D, metoprolol, E, baclofen, or F, vancomycin. And it's a select all that apply question that we have ready.
Okay.
Vancomycin, quinidine. Can you tell me the because there are lots of options. I don't remember the name.
Yeah, I'll repeat the questions. Question was which drugs will cause tinnitus? We have ketorolac, quinidine, furosemide, metoprolol, baclofen, and vancomycin. Oh, we have it in the chat box. One of my group mates typed it. If he wanted to see the choices.
Quinidine, furosemide, vancomycin.
Vancomycin.
Are you satisfied with the answer?
No, they missed one.
It's incorrect.
It's incorrect. Why is incorrect?
The correct answer. Do you want me to say the correct answer?
Yeah. So that is out of time. So yes. So that is means 0 for the 1 point for the person who group C.
So the correct answer for that would be quinidine, baclofen, and vancomycin. Those are the correct answers. So you missed one.
Okay. So please, I would like to have more specific questions. So one question, because it's kind of difficult to see that, to memorize all the options if you read it. So, but yeah, so let's try to minimize that. All right, so now I want group A, that is Kimberly, that is going to ask group F, that is Anila.
Okay, Dr. G, is it okay that we don't have choices, or can we just throw questions?
Throw that question. That's fine. Whatever you ask, that's okay. Good question. So you don't need to have options. Not necessary.
Okay. What medication should the doctor prescribe for a person with manic depression?
Okay, F.
Is it
Anila, Ismael, Rebecca.
does it start from T? Tazoped or something like that?
Can I give clue?
Okay, so only the group F is going to answer. Okay, so 30 seconds. So that group A as F, right? So group A have 1 point, and group one answer correct, and so giving point. If they don't receive the right answer, that is point for the one who make the question. So group,
sorry.
What is the answer?
Lithium.
Lithium.
Mood for the mood.
Excellent. So what is used lithium for again? Everybody, please.
maniac disorder.
Mood
Bipolar.
stabilizer, yes, exactly. It's actually mood disorder for maniac disorder, right? All right, so next, I would like to go group of Miss Krisa is going to ask questions for group D, that is Altia, the group of Altia. In there, Montserrat, Cyril, please participate. Okay, let's make it open so any of you can respond of the group. Okay, any of the group can respond. So let's make it more active, because if we going to go like that, I can see that only one person will be doing everything. So I want all the group responsible for the same thing. Okay, everybody collaborate, group collaboration. Okay, Miss Krisa, please, I want you to if you please ask question for Miss Anila,
Okay.
Ismael, and Rebecca.
Okay. In the magic twos, there are five major drugs names. I will name two of them, and please say the other three. One of them is digitalis, and one of them is lithium. What are the rest?
Fentanyl, theophylline, and vancomycin.
Perfect. Thank you.
All right, so that means 0 points for B and 0. So there is no points given to, so everybody have 0. So the one who is not answering is giving points to the one who is making question. Thank you so much. Very well. One more time, Krisa, you are there. So that is a randomized. I don't know.
Okay.
So
Who
we
am
have.
I giving it to?
Krisa is going to ask now to group C, that is Ruby Guevara, Fidel, and Cheyenne. Are you ready? Group B, please.
Yes. Hyperkalemia is one of the side effects of many medication, such as potassium sparing, which is a diuretic, AB, which is the ACE, and ARBs and beta blocker. Name the medication that is the action of osmotic diuretic.
Spironolactone.
Thank you.
Is correct? Are you satisfied with that?
Did they say what did they say again one more time?
I said mannitol.
Mannitol.
Yes.
Okay, so answer correct, 0 everybody. And this random make you have three in a row questions, Miss Krisa. So,
that's fine. Okay,
yeah.
who?
So B is going to ask now to group F.
So did we get a point? I don't get it.
when the questions are answered correctly, there's no points.
Boy, okay.
We only get a point when it's not answered.
Wait, what?
Right? Is that what it is? I'm kind of confused.
You get a point if the other team doesn't answer your question. If they answer your question, nobody gets a point.
There you go. Perfect.
Okay, thank you. Who said that?
Okay, thank you.
Miguel said.
Okay. All right. Now, Miss Krisa, you please, you're going to ask question for group F, is the Anila, Ismael, and Rebecca.
Anti-HIV, antiviral, anti-hypertension, and antibiotic has one side effect they have in common. What is that side effect?
Can you repeat it?
I'm up. Oh, okay. Anti-HIV, antiviral, anti-hyperthyroidism, and antibiotic. What side effect do they have in common?
30 seconds.
Bone marrow suppression?
Yes. That's correct. Bone marrow suppressant, BMS.
Okay. All right. So 0 points for everybody. No points there. Thank you, Miss Crisa. Thank you. Now we are going to go to Group C. That is Ruby Guevara, Fidel, and Cheyenne. They are going to answer question. They are going to ask a question, and the one who responds will be Altia, Group Inder, Montserrat, and Syria. Go ahead, please, Ruby.
Okay, question. A patient has been thinking about attempting suicide and telling the unlicensed or like a CNA about his plans. So, what would the nurse know is the drug that causes this? Again, a patient is thinking of attempting suicide and is telling maybe a CNA about this. So the nurse knows which of these following drugs could be causing this. Propranolol, vancomycin, phenytoin, or lithium.
Can you repeat the option again, please?
We have propranolol, vancomycin, phenytoin, or lithium. Which of these drugs could cause suicidal ideation?
Lithium.
That's incorrect. The answer is phenytoin.
Phenytoin. Yes. So phenytoin. So phenytoin can produce suicidal ideas? The answer is yes. So that is a wrong question. So a wrong answer, sorry. So Group C have a point. Okay, have one question that is answered in favor. C, D. Okay, so don't forget suicidal ideas, lithium. Lithium, phenytoin, correct? We get it? All right, so let's go to Group Kim. Kim, Group A, Joel and Lady are going to ask questions again to Group D, that is Tia, Montserrat, and Cyril. Go ahead, please, Joel or Kimberly or Lady.
Okay. What are the contraindication medications for SIAD, SIADH?
You say CH or what did you?
Yep.
I'm asking for the contraindication. I don't have options.
You say contraindication for SIADH?
Yes.
Anxiety or insomnia?
I'm asking about medication.
Altia, Sai, can anyone of you answer?
I'm not sure. Antidiuretic? I'm not sure.
30 seconds. So what is the answer?
Okay, she got it.
She got it? Okay, perfect. What was that?
She's not sure though.
Antidiuretic.
All right, so can you repeat that question, please? So for everybody to get the reinforce of the information, please.
Okay. What are the contraindication medications for SIAD, SIADH? The answer is diuretics medication.
CIH. What is CIADH?
S, Dr. G, not C.
Syndrome.
Antidiuretic hormone?
Yes, that one.
Antidiuretic hormone. So in that case, is high or low?
Should be high.
Should be high.
High. It should be high. Okay, so you're peeing a lot, correct?
Yes.
Yes.
So that's why diuretics are going to be contraindicated. That?
Yes.
Makes
Yes.
sense? All right, so perfect. The right answer. So now I want, please, Group A again. Kimberly, Corpus, and are going to make a question to group C, that is Ruby Guevara. Ruby Guevara, Fidel, and Cheyenne. Okay, go ahead, Ruby, please.
Oh, sorry,
Ruby,
are we asking again?
no, sorry,
or
sorry.
answering?
Kimberly, Joel, and Lady ask question to group C, that is Ruby Guevara, Fidel, and Cheyenne. So Fidel, Cheyenne, and Ruby are answering.
Okay. Which drugs cause reversible tinnitus?
Vancomycin for tinnitus.
Reversible tinnitus. Cause reversible.
Oh, then never mind. I thought you said tinnitus, like just tinnitus.
Reversible,
Like
right?
reversible
For
tonight.
irreversible.
Yes, aspirin, vancomycin, and all that.
Or quinidine.
I don't know how.
If it's reversible tinnitus, could be quinidine. The diuretics, which ones are
What else? So what is the answer? So are you satisfied with the answer or no? Group A.
Yes, they got it correct.
They got it correct. All right. So can you give me plain names, please? The names. So group A, just to enforce to the class.
Yeah, they said it. They said the loop diuretics. They said the aspirin, quinidine. Those are like the major ones that we were looking for.
Okay.
And it's gentamicin.
Okay. So the answer was correct. All right. So now thank you so much. Group E is not present, so Group E is not going to be nobody's Group E. So I'm going to skip that. Now Group A again, Corpus, Kimberly. You're going to ask questions to Krisa.
Okay. What do you call the test that finds certain antibodies that attack red blood cells?
Oh.
Comp test. I don't know how to pronounce it.
Yes.
Yeah, you got it.
Excellent. Very good. Is the Coombs test. Coombs test. Very well. Excellent. All right. So now I'm going to go to Group C. Is Ruby Guevara. Group Fidel and Cheyenne are going to make a question to Group E, but Group E is not here, so I'm not going to consider her, this group. Then D Group E is not here, so I'm going to delete here. I'm going to delete all the E's. Nobody is here from the E. So that is going to decrease, basically increase our chances to make more questions. Now, Group D, that is Altia, Montserrat, and Cyril, they are going to ask questions to Group G, Claudia, Miguel, and Samna.
Okay.
Okay, go ahead.
Wait, so it's not us, not Group C?
No, Group C is Fidel, Cheyenne, and Ruby are going to make a question. And the one who is going to answer is Group F, that is Claudia, Miguel, and Samna.
Okay, well, then I have a question.
Okay, go ahead.
So the medication metoclopramide is contraindicated in a patient with?
Hang on, Dr. G, is it Group F or Group G that's answering? I'm confused.
Oh, sorry, Group G. Sorry, Group G. Claudia, your group is going to answer. Group is Claudia. Yeah.
I can give them the options.
Okay. please.
So A, anorexia, B, cardiac arrest, C, adenocarcinoma, or D, pheochromocytoma.
What was the medication again, Fidel? I'm sorry. Metal.
Or Reglan.
Reglan. Okay.
Can you actually repeat the entire question, please? Sorry.
Yeah. So so the nurse knows that metoclopramide or Reglan is contraindicated in a patient with A, anorexia, B, cardiac arrest, C, adenocarcinoma, or D, pheochromocytoma.
Feel D.
You're correct.
Excellent. Very good. So can you summarize, please, the question, please, Fidel, just to make a reinforce to the class?
Okay, so metoclopramide is contraindicated in patients that have a pheochromocytoma.
Why is that?
It increases secretions of catecholamine.
You're talking about the metoclopramide?
It causes a hypertensive crisis.
Okay, so you're talking about the metoclopramide, right?
Yes. It's on slide 15.
Oh yeah. Okay. All right. All right. So there's your answer. Yes. Increase the secretion of the metoclopramide. Okay. All right. Thank you for that. It's a very good question. I almost forgot about that. Thank you. All right. So next, group C is Ruby Guevara, Fidel again. Oh, that's what F you. Yeah, you already answered, right? So the answer is correct. Correct.
Yes.
Okay.
Yes.
Now I want, please, group B, that is Miss Crisa, are going to ask Miss Claudia group, Miguel and Sabna. Miss Crisa is going to ask a question to Miss the group of G, of Claudia, Miguel, and Sabna. Go ahead, please.
Well, this is easy, quite easy. What action does lithium? Okay, now let me just rephrase that. Lithium, we know as earlier, is a bipolar disorder. What is the side effect of lithium? There's two main side effects.
Tinnitus?
No.
Oh, sorry.
It's
Let me go back.
Can I say?
What are our options?
I don't have an option. It's just like a fill in the blank.
Ten seconds.
Drowsiness?
No.
Okay, what was the answer?
The answer is diabetes insipidus and thyroid deficiency.
Okay, so point here. Can you elaborate a little bit about that, please, Miss Crisa?
Okay, so we know that lithium is a, well, from what I was reading in the slides earlier, previous week ago, we know that lithium is a bipolar disorder medication. And some of those side effects that is coming into the, what is it? AHD is low. So those ones will be the diabetes insipidus and thyroid deficiency.
Okay. Thank you. All right, so let's go. Thank you so much. So point for Group B. We have Group D, that is Altia, Inder, Montserrat, and Cyril. Montserrat, Cyril, and Altia are going to ask questions to Group F, to Anila, Ismael, and Rebecca. Go ahead, please.
These medications cause metabolic alkalosis. Which of the following option does not fall into this category? A. Acetazolamide, Alka-Seltzer. B. Alka-Seltzer. C. Thiazide. D. Loop diuretic.
Can you repeat the options?
A. Acetazolamide. B. Alka-Seltzer. C. Thiazide. D. Loop diuretic.
And the question is, which do not?
Yes.
The first one?
Yeah, I go with the first one too.
That is incorrect. Alka-Seltzer causes metabolic acidosis.
Alka-Seltzer produces metabolic acidosis. That is the right answer, or so what is doing Alka-Seltzer? It's a neutralize, right? So the Alka-Seltzer is going to produce.
I'm sorry, it was the right answer. Acetazolamide.
Okay, exactly. Acetazolamide can produce what? Metabolic acidosis.
Acidosis.
Okay. All right. So that was correct answer. Now I want Group F, Claudia, Miguel, and Samna. You're going to make a question to. So
Dr.
sorry.
G, we are Group F.
Or Group G.
Huh?
With me, Dr. G.
Okay. Sorry.
Group G.
Okay. All right. Sorry. So Group F is Anila, Ismael, and Rebecca are going to make a question to Claudia, Claudia, Miguel, and Sabna.
Okay, so the question is, which of the following beta blocker also has additional alpha blocking activities? And the options are pindolol, labetalol, nadelalol, and ismolol.
Could you repeat the options, please?
Okay. Nadolalol, pindolol, labetalol, esmelalol. I don't know if I'm pronouncing it right. Rebecca, can you?
First one, nadolalol.
Are you sure?
No.
That was a correct answer or wrong answer?
It's a wrong answer.
Can you elaborate, please, your question and your explanation, please?
So the question was, which of the following beta blocker also has additional alpha blocking activity? And the rationale is labetalol has additional alpha blocking activity.
Okay, so labetalol is selective, not selective?
No selective.
Okay. Okay, so point for Group F. Now, Group A, please, Kimberly. Kimberly, you're going to ask a question for the group of Claudia, Miguel, and Sapna.
Okay. Hold on. What is the slowest absorption for oral preparations?
That is based on the slides? That question is coming from the slides?
Wait. Hold on. It's from, okay, hold on.
From the slides, no, from the slides, huh? The questions need to be from the slides.
Okay, Joel will ask. I'm getting confused, Doc, sorry.
Okay, so who is going to ask?
Go ahead, Joel.
I'll ask. So let's see here. Okay, so what's a major side effect of excessive use of corticosteroids?
Immunosuppression?
No.
You want to know one or all of them?
No, we're looking for one specific and one important adverse reaction side effect from excessive use of corticosteroids. And I can.
So he's asking about side effect of using corticoids.
Diabetes mellitus.
No, that can make it worse, the diabetes mellitus. But so what
Are
are
we talking about inhale or just corticoid pill form?
All forms.
All forms. Okay.
Is it
okay? So 30 seconds. The answer is
it peptic ulcers?
Peptic ulcers? No. So he's trying to talk about something. All right. So can you
So what we were looking for is excessive. That keyword excessive use of corticosteroids.
Okay, so in order to answer that question, we need to have the whole picture in our mind, and the answer will be okay. So that is point for group A.
So
The answer will be
Cushing syndrome. So excessive use.
The Cushing syndrome. Cushing syndrome. So it's side effect will be yes, gastritis, we have irritability, all that the things, but probably the question was a little bit confused for the students because they have other side effects, and there was, but in order to, if you have the whole idea about corticoids, Cushing syndrome, that will, somebody was saying gastritis, and no, all right, so none of these answers are correct, or he wants to hear. So the other option will be the Cushing syndrome. Cushing syndrome. Cushing syndrome. Okay, so all right, so we just finished the first round of the questions. We can do a second round, but tell me so far. This is the first time we are doing this. So there's a way to make it better, or we okay like this?
I think if you get the answer correct, you should get a point.
The correct make a point?
Yes.
Yes, Dr. G.
Because some groups haven't even had the chance to ask a question, so they haven't had chances to get points.
No,
That's correct.
All the groups was having the same chance, huh? But I going to change that. No, why use Stella? What you said, Rebecca? Why you said no?
Well, there was a group that asked like 5 questions, and then my group only got asked to ask. Well, we had to answer several of them, but we only had one opportunity to ask a question. So I don't really think.
Oh, yeah.
Our group hasn't had any chance to ask questions. Group G.
Who? Okay, because the group F is not here. Oh God.
Yes, and Dr. G.
We are here, Dr. G.
Group D, we only asked one question, and I think we've answered maybe a couple of questions or so, but we only have chance to ask
Okay, all right. So what I'm going to do, see, this is a problem. Okay, all right. So I will. We have is 12:14, and suppose the break start at 12:30, right? All right. So 12:30. Let's do 45 minutes. I going to 45 minutes of break. That's okay. I'm going to fix the groups.
That's perfect,
Hey,
Dr.
Dr. G, I have an idea for you if you want to hear it about the problem.
Go ahead. Yes, Miguel.
So I know it's random, but if one group asks a group a question, the other group should have the opportunity to ask the first group a question too, so they both have a chance.
Oh, that's what I was thinking at the beginning. Why I
Yes,
did
Dr.
it.
G. Sorry to
Okay.
interrupt. To be honest, this is how I understood it before we even started. I thought that you're gonna randomize the group. So let's say you randomized it. It's gonna be my group, Group C against Group D, right? And then let's say Group C asks the question first. If they can't answer the question, we get the point. And if
Yeah.
they can answer our question, they get the point. And then
Yeah.
once we're done asking, it's their turn to ask the question, and then the same rules apply. Yeah, I thought that's how it was gonna work.
Okay. So, yes, that's give me some idea. So, if somebody if the group is going to ask a question and the other group is going to reply, so both they have the same options number, right? So it's matching the option, right? Yes or no? All right. So if you answer 5 times, you need to you can ask 5 times. So I'm going to reverse this. I'm going to reverse. So now it's going to be GC, FG, so etc. So I'm going to reverse those. So it's going to be even. So I don't need to change anything, by the way. So what the only thing I'm going to change is the suggestion that you give me. If you answer right, you want to make the group who answering right have the point. That's what you want?
Yes.
Okay. So the group who answer correct is going to have the point. Okay. And I'm going to make it 15 seconds instead of 30 seconds. 30 seconds is too long. Okay. All right. So I'm going to organize that. All right. Yes, I'm going to see you at 1 p.m. Okay.
Thank you,
Thank
Dr.
you.
Dr. G.
Thank you.
Yeah.
Thank you.
Thank you.
You're presenting your screen, Dr. G. Dr. G, your screen is presenting.
Actually, because this is a contest, it's not a grade, so it's okay to show the how is the scores going or no? Or no? Or yes?
It's okay.
That's okay. You're good.
Okay. So basically, I need to change something here. Oh no, but this is by person. Okay, so we have here. So that's okay, right? That is okay. I think so, right?
Yes.
So if I make a mistake, you tell me. Who is not here? Who is not here? So you see here the average on the side. This is actually
Yeah, we see the average on the side.
Yeah, so that is what is counting. The same thing here on the second, and the second was the same. And the same. But here we have a clear coming. So at the end, everybody was still here at the lunch. So this is the lunch time. So we're going to consider that already. So it's the same. And here we have here. Let's see. So we are going to make it even. I know that I understand that some of you are having more questions than others. So that is 3 points for each question or gain. What you gain, so 3 points. So I'm going to put it here in the middle. Okay, it's not necessary. So it's just accumulation of points. So we have 2 answers right here. 1 answer right here. 3 points. 3 points. So I reverse. So I just modify that. So if the other person didn't answer, point for the one who. No, what is yes?
Wait, why did we get 3?
Sorry?
We answered a few questions correctly, Dr. G. And then we didn't answer another one. So
Yeah.
we asked like 5 questions already.
Okay, yeah. So 0 means you answer correctly. Oh my God. What is this? This is so simple. This. So for example, C, G, I put 1 point is because you didn't answer correctly, the G.
We did. Or for which one?
No, I have a list here, so I'm trying to.
Oh, okay.
Yeah.
Because I was we asked 2 questions, and then they didn't answer it correct. So what does that mean?
That you have 2 points. Which group is this?
C.
C, right?
For Ruby, Cheyenne, and me.
Yeah. Yes. Yeah. I have that. So, yes.
And we answered correctly too.
Okay.
Oh, never mind. The correctly aren't being counted. Okay.
See. Okay. I don't know. Okay. So that's fine. I need to just try to make it simple for everybody. Okay, 3. No. Yeah, so that's why you have okay, my God. What happened to my brain? Okay, let me check it. Yeah, I see. Yeah, I have everything correct here. So C they have two answers that the other student didn't answer, so you win those points. So C is having 6 points. C having 6 points. A is going to be a 3 points. B 0 points. But you answer questions, right?
I only answered one question and I answered it correctly.
Yeah. Okay. I see what happened here. Yeah. Okay. So D, A, B, C, D, E, F, G. Okay, A. A, 1, 2. Well, there is no A. 2. My God, this is a mess. Okay, so let me remove the students who are not here. Otherwise, it's going to be a mess. Let me check it out. Not now. What happened? Okay. So these 3 are not here anymore. Who is this? Here is not. This group is not. Okay, I'm going to delete all this. Okay, so 3 here. No. Okay. A, B, C, D, E, F. Okay, so let's see. I have. Oh, I see. I don't know how I did it. My God. Okay. 1, 2, 3, 4, 5. This is going to be E, C, E, F. Oh, yeah. C, D, E, F. A, D, E, F. A, B, C. Okay, so B, C, D, F. See, this is going to be out. A, B, A, C, A, B, where is A, B? A, B, A, C, A. Yeah, I don't know. I have so much headache right now. Okay, let me. So we have a few more minutes. Organize this. Okay, I see. A. Dos, tres, cuatro, cinco, F, right? Don't come. I'm not in the mood to go.
I think that's better, Dr. G, how you have it there.
Yeah, but what about if I cut the? So this is one way. But if I do reply here, can we do reply A B and then B A? So we don't need to reply this, right? B C and C B. So that is going to be in one way. So how many options we have? 1, 2, 3, 1, 2, 3, 4, 5, 5 times 6, 30 times. But if we go back and forth, I think everybody has the same options, right? So let's do this, right? This one. So,
Yeah, if you keep it with that layout, it'll be easier for you to keep track of the points instead of going back and forth.
Yeah. So we agree that the one who make the question, okay, and okay, if I make a question to you and you don't answer, I have a point, correct?
Yes.
Okay. If I make a question and you answer correctly, I don't have a point, okay?
Okay.
All right.
I think they were asking the other way around, Dr. G. They wanted points if you answer correctly.
Oh, okay. So if you answer correctly, okay. If you answer correctly, yeah, if you answer, so the one who make a right answer have a point, correct?
Yeah.
Okay, if the person doesn't answer, is the answer, so if I answer correctly, I have the point. Okay, so that's okay. But if I don't answer the question, I have 0.
Then the person that asked the question gets the point.
Okay, so all right. Okay, got it. So if I answer, so always somebody's going to get the point, always, right? So if I answer correctly, I have the point. If I answer correctly, right? If I don't answer correctly, the one who make the question will make the point.
Yes.
Yeah.
Okay. So we are leaving like this: A B, A C. So we can use this frame in order to do what, to make equal chances. So let's see here. I'm going to randomize that now. So we stay with that, right? Can we stay with that or no?
Yes.
Okay. Something different.
Do you want to delete the ones where group E is asking questions since no one is here?
Sorry there, what?
Group E isn't here. Do you want to delete their section?
Oh, group E is not here. Oh, yeah.
Already deleted. No, because we were G and now we're F. So group E, Dr. G already deleted persons that were there.
Yeah, I already delete group E. So there is no, the group E is conformed by Adriana, Daisy, and Monica. So they are not here. So now you're going to be different group.
We are now group F instead of G.
Yeah.
Okay, so then we're group E now. Okay, thank you.
Yeah, so I need to. Okay, that's correct. So this is a new group. Okay. Okay, so we're going to do this now. So there is no group. There is no G, so that's why. Okay. Okay, now let's go to this map here. This is the new. Okay. Win here. Win here. This is incorrect. This is So we are going to do the reverse, and so that's it. So that's why we have so far, what we have so far. I'm going to tell you. All right. Okay, so let's see. Please, can you hear me? Okay, tell me, please, how many times Group A answered correctly? Just to corroborate here. Kimberly, how many answers you have?
We didn't answer any questions yet. We asked questions like three times already.
Yeah, but how, 3 times. So you have how many answers you have correct?
I think 2.
2. So 6
2.
points.
Is it right, Joel?
Yeah, 6 points. Yeah. That is supposed to be here. What I'm talking about here. What is it doing? Oh, God. Okay. Chris, how many answers correct you have?
She answered one of our questions, Dr. G.
Yes. So I answered 5 questions. I asked 5 questions and I only answered 1 question.
No, how many correct answers you have?
1.
Okay, so it's 3. How many correct answers you have, Ruby?
I answered other groups, Dr. G.
Oh, Ruby.
Yes, this is Ruby.
Yeah. How many correct answers your group had?
Sorry, I'm just confused, Dr. G. Are you asking how many answers
Correct.
or how many questions we've answered from other groups?
No. How many questions you have right? So okay, so I will tell you. How many questions you answered you were right?
My group asked 3 questions.
No, how many questions you answer?
Oh, answered from I lost count from that, to be honest. I'm just answering. I think we answered 2 or 3. I know Fidel was answering 2 earlier.
Fidel, can you tell me how many answers correct you have in your group? In the group?
I don't know, but I'm pretty sure Ruby answered all of them, but we just don't know how many questions we got answered.
There was 4 questions, yeah. Tia, your group, how many correct answers you have?
We asked 1 question.
How many? A number, please.
I think we've answered 2 questions right.
Anila, how many questions right you have?
4 correct answers.
See, how many right answers you had in your group?
4.
4?
Yes.
Miss Claudia, how many right answers you have?
We answered 2 correctly, and then we were asked a few.
Okay. All right, so that's going to be summation.
Question, Dr. G. So you reversed it. So those questions that were not answered correctly, those points don't count anymore, correct?
Exactly, yes.
Perfect.
It's the same. But Inder is not here, right?
No, she's not here.
Yeah, but it's average, so it's okay. So it's okay if she's not here. So okay, I can delete this if you just to make it more accurate. So instead to divide it in by 4, I'm going to divide it by 3. This is divided by 3. This is divided by 3. All right, so that is what we stay with. Okay, so that is average so far that we have. Okay, so you know what's taking the lead. So I'm going to start calling the groups. Okay, so we are going to reverse the previous round, and then we are going to start with a new sequence. Okay, the new random. All right, so I want group F. Claudia, please ask a question to group C, that is Ruby Guevara.
Okay.
Okay.
What medications can cause Steven-Johnson syndrome?
Did you want more than one? There's Ketorolac.
Yes.
Okay,
That's three. Mention 3.
Mention 3. Ketorolac, allopurinol, sulfas.
That is correct.
That's correct. So the point go to group C, correct? Right?
Yes.
Okay, so that is okay, perfect. All right, so now let's go group E. The new group E is going to give questions to group A.
Okay. What is cyclosporine used for?
I'm sorry, can you repeat the question?
Can you repeat? Sorry.
Okay. What is cyclosporine used for?
It's used to treat inflammation, rheumatoid arthritis, or psoriasis and psoriasis.
No.
I have a question. Can other groups like steal the question?
No, let's not make complicated. Let's not make complicated. It's already complicated right now. All right, so what is the answer? So E, group E with A. So
the answer.
that is the wrong answer, right?
Yes.
Yes.
Okay. So that point go to group E. So can you elaborate, please, on that question?
So
group
it's used to prevent organ transplant rejection.
Exactly. So that is used for rejection. It's going to be for rejection. So it's going to be cytostatic to prevent rejection of transplant organs. Okay, is that clear? Is that clear or no?
Yes, Dr. G.
I was gonna say that, but you didn't steal the question.
What, Fidel?
No, I was saying that I was trying to say that, but because I thought we could steal the question.
No. Only the group who is asking. No, only the group who is who is assigned to answer is going to answer.
Okay.
No, nobody else. Okay, so but yeah, if you are between the group, you can answer. Yeah. All right. So DB. So group D is Altia and is going to ask questions to Krisa.
Neuroleptic malignant syndrome is a life-threatening reaction that occurs in response to antipsychotic medication. What are other adverse side effects when taking antipsychotic medication? A. Parkinson-like syndrome. B. Dyspnea. C. Bradycardia. D. Alertness.
Parkinson.
That's right.
That's right. So that answer, that point go to B, correct? Right?
Yes.
Excellent. Okay. Now let's go to C to B. So C is Ruby with Chris again.
Okay. C. Oh, are we asking now?
Yeah, Group C. Group C is Ruby Guevara asking Krisa.
Okay. So the nurse knows that nitroglycerin is contraindicated in a patient with metabolic alkalosis, severe anemia, liver impairment, or renal failure. Again, the question is, the nurse knows that nitroglycerin is contraindicated in a patient with, and my choices would be metabolic alkalosis, severe anemia, liver impairment, or renal failure.
You said nitroglycerin, is that
Yes.
correct?
Yes. So if a patient is taking nitroglycerin,
And okay, and then so one more time for the
not
question.
taking nitroglycerin.
Oh, not taken or taken?
So what would be a contraindication for nitroglycerin, basically?
That's good. That's a way to answer to ask a question. Thank you.
So what would be a contraindication for nitroglycerin? Would it be metabolic alkalosis, severe anemia, liver impairment, or renal failure?
Renal failure? Sorry.
That is
The
incorrect.
answer is severe anemia.
Got it. Thank you.
So why severe anemia in nitrates?
When I was reviewing the super slides, I learned that because when a patient has severe anemia, if they take large doses of the nitroglycerin, it can cause oxidation of the hemoglobin, and it could make the anemia worse.
Okay. So that's who answered right was C or B. Who answered right?
C.
Nobody answered. I didn't answer.
Oh, but that point to go for the one who make the question, correct? It was in
That's correct.
Okay. So the answer the point going to go to C, right? Right.
Yes, that's correct.
Okay.
Dr. G, I didn't get the point from earlier.
Yes.
I'm still at 3.
This is 3. No, this is 3 and 3. So, yeah, you're right. Okay, so there you are, 6. This mnemonic is, oh my God, I guess. So I had to make some more time preparation, seriously. And this is, okay. But that's okay. This is a game, that's all. So, all right, so 6 points there. They're going, I need to create another for mnemonic in the next hour. So are we okay now, Krisa?
I think so. Yes.
All right. So now,
Dr. G, I'm sorry. Altia answered question the other time also, and I don't think we got a point for that.
For what?
The one Altia answered?
Here?
Yes, we didn't get a point for that.
When was that? In the first round or the second round?
Now, this round.
Oh, okay.
Answered.
Okay. Well, I will trust. Okay, EB. EB is going to be Anila asking Krisa.
Okay. Why can't we take isoniazid with aluminum or antacid?
Because it will reduce the absorption.
Correct. Decrease the absorption.
So that point
That's
goes.
funny. I actually made that question up too.
Okay.
Thank you.
Okay, so that will go point to Krisa. Okay. B and C. So who is Altia is going to ask question to Ruby group. Altia group to Ruby group.
Hydralazine can produce a seizure pyramidal disturbance, B tachycardia, lupus erythematosus, C acute hepatitis, D aplastic anemia.
Is it B?
Yeah.
So who answers? It's lupus, right? Lupus, like?
Yes.
Yeah. All right. So yes, I want just to everybody can to hear the question. I mean, to retain the question. So it's a little bit difficult because we are online only. But yeah. So let's try to make a summary and to make a conclusion in order to reinforce the material for the rest of the group. All right. So D and C, right? So who answered right? C, correct? Who answered which group answered correctly? C, right? So that means 3 more points, 9 points. Okay, so now I want group D, that is Altia, ask question to group A, Kimberly. Corpus to corpus.
A patient is given naltrexone. How long will it last?
Which medication?
Naltrexone?
Six hours?
Yeah.
6 hours. Okay, so that is group A, right? Group A have 3 points, correct? He answered correctly, correct? Okay?
Yes.
Yes. Okay. Next. Group C is Ruby Guevara is going to ask questions to Kimberly.
Okay.
We're gonna ask.
Ruby Guevara asks questions to
Okay,
Ruby.
you want to do it
Ask the question. Kimberly is going to answer.
Okay. So we have a patient is taking rivastigmine.
Just a moment. Just a moment. C asks the question. C is Ruby Guevara is asking questions to Corpus Kimberly.
Yes, Dr. G, this is our group.
Oh, okay, okay. Yes, yes.
Our group.
I'm sorry. I apologize. Go ahead, please. Be there.
So a patient is taking rivastigmine or Exelone as part of their anti-Alzheimer medication regimen. The nurse will look for what side effects, and this is a select all that apply question. A, headache, B, anorexia, C, dyspepsia, and D, weight loss, or E, palpitations.
Anorexia and dyspepsia.
That is correct.
Okay, so that point go to group A, correct?
Yes, that's correct, Dr. G.
3 more point 6. Okay. Now we have, thank you. So B and A. So Krisa, you're going to ask to Kimberly. So when I say Kimberly, I mean the whole group. Huh? I'm not going to mention the whole group every time. So Krisa, go to the group of Kimberly.
So I'm asking the question.
Yes, you're asking the question.
Okay.
And
Okay, got it.
Corpus is going to answer.
Okay. You cannot take this medication with aluminum or antacid because it will decrease absorption.
Is it antacid?
No. So once again, I'll repeat the question. You
Thank you.
cannot take this medication with aluminum and antacid because it will decrease the absorption. What is the medication name?
Can you specify a little bit, because there is a lot of medications outside that cannot be taken with aluminum. Yeah.
Isoniazid, is that the one you're looking for?
Yes, that's what I'm looking for. It's anti-tuberculosis. Sorry, yes. That's
Antituberculosis.
the one. Anti-tuberculosis. That's the one that lady said. That's
Yeah,
correct. They got the point.
Okay, so that is A, right? A got the point, right? So 9 points.
Yes.
Okay. All right, so there's other medications you cannot take it with that. So tetracycline 2, for example. Yeah, all right, so group F is Claudia group are going to ask questions to Altia corpus group.
The nurse is planning to administer hydrochlorothiazide to a client, which are concerns related to the administration of the medication. One, hypouricemia, hyperkalemia. Second is hypokalemia, hyperglycemia, or sulfa allergy. Third is hypokalemia, increased risk for osteoporosis, and hyperkalemia, hypoglycemia, penicillin and allergy.
It's a lot of effort doing this verbally, huh? Right?
No, I posted the answers in the chat.
Oh, okay. Excellent. Very good. Thank you. Hello? Where is D? D need to answer? Altia? Montserrat? Cyril?
Can you repeat the question?
Is it hypokalemia, hyperglycemia, and sulfa allergy? It's B.
Yes.
That's correct?
Yes.
The answer the points go to group D, right? Corpus, right?
Yes.
3 points. So something is need to modify here. Why is not? Yeah, that's fine. All right, so now group E, Anila is going to answer questions to, no, group E is going to ask a question, and the one who is going to answer is group C, Ruby Guevara.
Okay. How often should weight be assessed for a patient taking lithium?
Is it a select all that apply or
No.
You
So
said how often should... Sorry, go ahead.
Yeah. How often should weight be assessed for a patient taking lithium?
Every 3 months.
Yes.
So C answered correctly. So that is going to be points for group C, correct?
Yes, that's correct.
Dr. G,
Yes.
this is Altia's group. We did not get the point earlier.
Are you sure?
I'm sure.
Okay. We trust. Yeah, we trust. Okay.
Yeah, I just answered correctly just now, Dr. G. It was the hypoglycemia.
Okay. Okay. We need to create some system next time for this because it's okay. That's fine. All right. So now there's 4 more rounds here in the to finish the previous rounds to make it equal opportunities to everyone. Group F, Claudia is going to ask a question, and the group who is going to answer is B, Krisa.
Okay. I don't know if I am pronouncing this medication correctly. What condition will be, in what condition will sucralfate be contraindicated?
In which condition the sucralfate will be contraindicated?
Correct.
Okay.
Sure.
Do you answer? Oh. Oh, yeah. Yes, take your time.
Diabetes mellitus?
Correct.
So, what sucralfate cannot be given in diabetes mellitus?
Diabetes mellitus.
Yeah. Why is that? Is that saying the slides?
Hyperglycemia, right?
Oh, yeah.
Diabetes mellitus.
Yeah.
For hyperglycemia.
All right, so who answered that correct is B, right? Krisa. So you have 3 more points, 9.
Yes, B.
Okay. Okay. Next question is ED. So E is Anila, and who is going to answer? D. That is Altia group.
Okay. What alpha-1 blocker should be used when nitrates or CCB are not fully effective?
Could you repeat the question, please?
Yes. What alpha-1 blocker should be used when nitrate or CCB are not fully effective?
Is that pentolamine?
Yes.
All right. So we have the group D answered correctly. So that means 3 points additionally for group D. Oh, what did I do? 9 plus 3. Okay. All right. So group F, group F is making the question, and group E is answering the question. Is answering. Group F, Claudia, question, and group E, Anila, answer.
Miguel?
Miss Claudia?
It's me, though.
Miguel asking.
Who is asking? Is going to ask Claudia group ask a question.
Yes, Miguel is in my group. Miguel will be asking the questions.
Oh, okay.
This is Sapna, Miguel, and myself. So he will be now.
Okay.
The nurse prepares to reinforce instructions to a client who is taking allopurinol. The nurse should include which instruction in the plan? A. Instruct the client to drink 3,000 ml of fluids per day. B. Instruct the client to take the medication on an empty stomach. C. Inform the client that the effects of the medication will occur immediately. Or D. Instruct the client that if swelling of the lips occurs, this is a normal expected response. I'll type the answers in the chat as well.
Hello?
We're waiting for the choices.
Oh, do you see writing the answers?
He's typing it.
I was typing it.
A.
Yeah.
What's the summary of the question and what is the answer, please? Because I want
So,
to.
A.
So the nurse is preparing allopurinol. Which instructions should the nurse give to the patient?
Okay.
Is the summary.
And what
And they
was
said,
what was the answer?
they said instruct the client to drink 3,000 mLs of fluid daily.
Yeah. That is the correct answer. That is the correct answer, or no?
Yes.
Okay. So the point go to group E. Right?
Yes, we didn't get our points from earlier, Dr. G.
Okay, I'm going to just rely on the. All right. So everybody can see the joint. So please, if there is a mistake, let me know, please. Okay, I apologize. It should be more kind of more flow, but that's fine. So you're doing your effort, and thank you so much. I really appreciate it. Group F or Claudia is going to ask a question to Kimberly, and with that we close the cycle of the previous questions.
Dr. G?
Yes.
I feel Group F they haven't answered a question. I think they've only asked 3, but they haven't had the opportunity to answer questions.
Yeah, last time we answered and we didn't get to ask any question. It's, I think, balanced now.
You didn't answer any question, Claudia?
No, Dr. G, last time we didn't get a chance to ask any question. We just answered. This time we didn't get a chance to answer any question. We just asked.
Yeah, that's fine. That's why. That is the other side. So this
That's
is
how it was for us, Group A.
yeah. So that is okay because I was going in one way and now it's the other way. So that is one cycle. So on the first part you was asking a lot of questions. In the second part you didn't ask questions at the first time. The second part you're going to ask questions. So
Okay, our question is isoniazid is prescribed for a 2-year-old child with a positive tuberculin skin test. The mother of the child asked the nurse how long the child will need to take the medication. What time frame is appropriate for response to the mother? One 4-month, second one 9-month, third one is 12-month, and fourth one is 18-month. 4, 9, 12, 18.
12 months.
No,
what is the answer?
9 months. B,
9 months.
second one.
Okay, so this point go to group F, correct?
Yes.
Okay, so with that, we close the cycle, the first round of questions. Now I'm going to go to the new set. Where is the new set? Oh,
Dr. G.
Yes.
A quick question. So isoniazid for infants, it's given shorter than for adults?
Yes.
Or...
Yes.
Okay.
Yes. Okay, so I have here the new sequence of, I show you, we created just a few minutes ago. And in this case, we have half an hour only. So let's just try to do, because we have like 21 questions, so 42 questions in half an hour. So we can take a little bit more time to close the cycle. So, all right, so I will start, okay? So in this case, for example, we have the E, Group E. I'm not going to say names. You know which group it is, okay? Group E and Group D. So the second group is the one who is going to answer. And then Group D is going to reply to Group E. You okay with that? Now it's a reply.
Yes. It's confusing, Dr. G.
Okay. All right, so Group E, please. Group E.
Yes.
To Group D.
Okay. So I'm going to ask question. Okay, apart from nausea and diarrhea, what is another use for on ondansetron. Ondansetron, yeah.
Ondansetron.
Yes, ondansetron. Sorry.
No, that's fine.
Wait, I'm sorry. Is it
for irritable bowel syndrome?
Yes, correct.
All right, so that point go to D, correct?
Yes.
Yes.
Now, please, D ask a question to E.
You said B?
No, D as in dog. The reply, a reply. So this E and D. E ask question first, and then D ask the question after. As a reply. Okay. So E and D. So which group is E? E is Anila, and D
Yes.
is D is Altia. So Anila was asking a question to Altia. Now Altia is going to reply to Anila. Okay, so that is going to be go and back. Okay, so please, group D ask a questions to E.
A client with angina pectoris has been given a new prescription for nitroglycerin transdermal patches. The client indicates an understanding of how to use this medication administration system by making which statement? A, I need to wait until the next day to apply a new patch if it falls off. B, I need to alternate. Excuse me. Oh, sorry. I need to alternate daily dosage times to prevent tolerance to the medication. C, I need to place the patch in the area of a skin fold to promote better adherence. D, I need to apply the patch in the morning and leave it in place for 12 to 14 hours as directed.
Can you repeat the choices?
A, I need to wait until the next day to apply a new patch if it falls off. B, I need to alternate daily dosage times to prevent tolerance to the medication. C, I need to place a patch in the area of a skin fold to promote better adherence. D, I need to apply the patch in the morning and leave it in place for 12 to 14 hours as directed.
D?
That's right.
Okay, so E is going to have points, correct?
Yes.
Okay, so please, I suggest to have straight, more short questions because short questions and more straight answer is okay, but it's more short questions just to elaborate. If you have all the statement, just make a conclusion and ask the question that is going to be easier to retain for the other groups. Okay, because I want everybody to grasp the question, and sometimes I get lost too. Okay, so please, let's do that. All right, so now let's go C and B. C and B. C, ask question. B as in boy, answer the question.
Okay. So rivastigmine or Exelon would be contraindicated for a patient with liver impairment, metabolic acidosis, GI bleeding, or irritable bowel syndrome. Again, the question is rivastigmine or Exelon will be contraindicated for a patient who has a liver impairment, metabolic acidosis, GI bleeding, or irritable bowel syndrome. I'll have the choices in the chat box.
GI bleeding?
Yes, that's right.
Correct.
That's correct. So,
Okay.
so the one who answered was B. B having extra the points. No. C. No, who?
No, it's B. B,
B.
Dr. D. I'm the only one. Please give it me.
Okay. All right, then.
I'm running out of questions. So, okay, GI disorder, vision changes, and arrhythmias are side effect of A, lithium, B. Digitalis. C. Diuretics.
Digitalis.
Thank you. Yes, they got it.
Okay, right? Okay. All right, so we got the point there. All right, so now it's going to be between A and F. Kimberly versus Claudia group.
So are we going to ask the question, Dr. G?
The first one I mentioned is the one who asked the question. So it's
Okay.
Kimberly versus Claudia, yes. So Kimberly asked the question. Claudia answered the question.
Got it. I can go.
Okay.
Go ahead.
Okay, so which medication causes hyperkalemia? We have A, aldactone, B, furosemide, C, mannitol, D, lisinopril. We have E, which is option A, C, D, or F, which is option A and C.
Could you repeat that, please?
So which medications cause hyperkalemia? Aldactone, which is spironolactone, furosemide, C, mannitol, D, lisinopril, or option E, which is A, C, D, or option F, A and C.
Is this multiple choice?
Yeah, so which one causes hyperkalemia?
Give us 1 second.
1 second forward.
Come on.
I'm communicating with my group, sorry. I don't want to just sit here and say the wrong thing.
So it's aldactone, which is spironolactone, furosemide, mannitol, lisinopril, or option A, C, and D, or option A and C.
15 seconds.
What was that?
Go ahead.
A and C?
Incorrect. So it's E, option A, C, and D.
Dang, yeah.
Okay, so that answer, correct answer, go to A, correct? Right?
Yes.
Plus 3, 12. Okay. Okay, so the things are getting tight. Now, reply, please. Reply. We have Claudia is going to ask to. No.
I have the question.
Yeah.
So a client is receiving digoxin daily. The nurse suspects digoxin toxicity after noting which signs and symptoms, and this one's going to be select all that apply. 1, visual disturbance. 2, nausea and vomiting. 3, apical pulse rate of 63 beats per minute. 4, serum digoxin level of 2.3. Or 5, serum potassium level of 3.9. Would you like me to type it in the box or no?
Yes, please. Yes, please.
It's the nausea and vomiting, the rhythm of, you said 56 beats per minute.
Wait, was it 56 or 63?
I said 63.
Oh, oops. And then what was the first option?
Visual
I think
disturbance.
chat.
The
Now,
visual
can you write it down? Yeah.
Visual disturbance and nausea and vomiting.
So the correct answer is 1, 2, and 4, which is visual disturbance, nausea, vomiting, and the serum digoxin level of 2.3.
I actually didn't even get to see the answers before. All right, cool.
What?
We didn't see it in the chat box. We just saw it now.
So now, where we stand now? So he gave already the answer, and you said that you didn't read it. So what we do?
It's okay, doc. We're just saying it that we got the 1 and 2 correct, but not the serum digoxin level and the potassium.
I didn't get that one right.
Yeah.
So what I should do? Put wrong, or is point for A or point for F?
Split the points. Just kidding.
Split the point. What I should do?
I guess point for F then. Yeah, I got 2 out of 3 right.
Right.
But I didn't get everything.
So F is going to have the points, right?
Yes.
Okay. Please try to make simple the questions. Don't put the select or apply. It's very difficult. So I know that you want the point, but don't make it so hard on the rest. It's okay to be harder, but not so bad. You're meaner. You're more mean than I. So don't be that mean, please. All right. C to E. C to E. C is Ruby Guevara. To E is Anila group.
Okay. So if a patient is prescribed a bulk forming laxative or metamucil, the nurse will not administer this laxative if the patient has which of the following: abdominal cramps, headache, diarrhea, or nausea. Again, if a patient is prescribed a bulk forming laxative or metamucil, the nurse will not administer the medication if the patient has which of this following: abdominal cramps, headache, diarrhea, or nausea.
Diarrhea?
That is incorrect. The answer is nausea.
Wait. What? So you're talking about Phycilium, right? The Citrusel, that guy, right? So you're talking about bulk fiber, right? Yes or no?
Yes.
So why would be contraindication on nausea?
Well, my group and I based our questions on the super slides.
Okay, all right. So that is one of probably. All right. So nauseous. Why? Because what could be nausea? Diarrhea. Diarrhea will be contraindicated or no? It's the indication for Citrusel, right? Abdominal pain. Between nauseous and abdominal pain, what could be better answer? Nauseous.
I would say A, because I remember answering this question before.
Yeah. All right. So let me go here. The slides. So what was that? Citrusel. What was the medication? Citrusel, right?
Metamucil. It's actually spelling correctly there. It's spelled as METH.
Oh yeah. Metamucil. This is the thyroid. Abdominal pain. Abdominal pain is not cramp.
Yeah, that's what I'm saying. A should be the answer.
Yeah. So nauseous is additionally, but I will say unexplained abdominal pain is more relevant than nauseous. So so both answers, you are right. So what I'm going to do is what?
I thought they answered diarrhea though.
Means for everyone.
Okay, so, but no, if I put points for everyone, everybody is going to, you're going to increase your average compared to the rest. So, do you have another alternative question?
We do.
Okay, so please, can you go ahead?
Ruby, Ruby, do you want to say it or?
Yeah, go ahead, Fidel. You can ask this time.
So we have a patient with the diagnosis of TB, and he will be taking INH as part of his anti-TB therapy. So what priority instruction will the nurse provide? And this is the dosage of INH the dosage of INH maybe need to be higher because of the slow acetylation process. B, he will need to take the combination of anti-TB drugs for a successful therapy. C, he should not take aluminum or antacid because it decreases absorption. Or D, do not take vitamin B6 because it will cause neuropathy. And I'll go ahead and
C.
C is the correct answer.
Okay, so group C is, no, E is going to have the points, correct? Right?
Yeah.
Yes.
Okay, so there's a tie now. All right, so thank you. Now, E, can you ask a question to C, please?
Yes. Dantrolene is the antidote for what medication?
What do you say, dantrolene or
Yes. No, dantrolene
Uh-huh.
is the antidote for what medication?
Okay, C. Who?
Will you give us options or do we have to just guess?
Yeah, just guess. I'm sorry.
Oh, sorry, I missed the question.
Okay,
Can you repeat the
dantrolene.
question?
Yeah, dantrolene is the antidote for what medication?
Yeah, that is.
Reglan?
No.
No.
The answer is?
Metoclopramide.
Reglan is a
Oh,
brand name.
yes, sorry.
Wait, okay, so again, the antidote, the dantrolene is used for what? Are you okay? So let's see.
No, they're saying that but so wait, so I'm correct though, right?
Yeah.
Yeah, for neuroleptic syndrome. Okay, perfect. Okay. Oh my God, I'm losing weight here.
Dr. G.
I'm losing weight here. So who answered?
Yeah, have a great
It's E, right? E?
Group C.
Oh, group C. Who got the point? Group C or group C, right?
C as in cat. Dr. G's cats.
Okay. All right. All right. So now next group. F versus C.
Again?
Oh, that is already. Okay, no.
Should be A.
Yeah, we've actually been going Dr. G, group C.
Okay.
Dr. G.
C. Okay, so now it's BE. BE. B
Okay.
against E.
Okay. My question is, what medication is used for multiple sclerosis?
For multiple sclerosis, you said? Oh, multiple sclerosis. Sclerosis.
Yeah, sorry, sclerosis. Yes,
Okay.
Multiple sclerosis, right?
that's correct. Sorry.
That's fine.
Is that the gabapentin?
I have bancofin.
Yeah.
So what was that? Let me see. What was the question?
It's the same medication.
Baclofen.
Yes. So,
There you are, baclofen or gabapentin. Baclofen. Okay, so who answered correct? Yes, guide me, please, because I. So who answered correct?
that was E answered correctly.
E answered correctly. Okay. Okay. Now I want, please, B ask a question to E.
I just did, Dr. G. It's the reverse now.
Oh,
E will ask me.
okay. E. Okay. Go ahead.
Yes. Okay. So what side effect would you notify the HCF for the patient taking Dunaprocel?
Ask the question.
Okay. What side effect would you notify the HCF for the patient taking Dunaprocel?
The healthcare provider.
This was the right answer.
It's nausea, vomiting, and diarrhea.
Yes.
Yes.
All right. So that point go to whom?
To Krista.
Krista.
Krisa. Okay. So this where is Krisa? Okay. Something's wrong here with your grade. So 18. 50, you have 18 points, so that means that you have 18 points. Yeah. So if you have here 3 plus 15, 18 divided by 1 is going to be 18.
You've been giving her 3 points instead of 1 point, Dr. G.
Sorry?
You've been giving her 3 points. There's only one person in her group.
Dr. G.
It's 3 points per group. It's 3 points. Oh, yes.
Sorry. We feel like Group D hasn't really answered questions. We've answered only 4 times compared to the rest of the group.
Okay. All right. So let's do that. Tell me one thing. Okay, so let's make it because it's already 2 o'clock. Tell me one thing. Group A, Corpus Kimberly. How many questions? Please try to remember that. How many questions you made?
We made about, I would say about 6. Like the whole 2 rounds already. We've done about 6 questions.
And you answered how many?
4.
4.
Yeah, 4. Yeah.
Group B, how many questions you make, Krisa?
So far on my list, I have 8, and I don't know how many questions I have answered. Because in the first round, I just been giving question, and I only answered 1. This second round, I've been answering as well.
Group C, how many questions you made, please, Group C?
So far we have, say, 7 or 8. Let me check. Yeah, we have 7 questions.
Group C?
Yeah, but I don't know how many we've answered.
Yeah, honestly, Dr. G, I'm so sorry to say this.
It's a mess.
I'm still lost, and we've just been answering and asking, whatever you ask us to do.
Okay. All right. So it's 2 o'clock. How we that was really not so good. I mean,
What about this?
well, tell me.
Why can't we come up in conclusion how much point we should all get, and just to be fair, let's forget about this and we all get that point. So there's no we are all here, we came prepared, we all answered, but unfortunately there was not equal amount of answering and equal amount of questioning. So let's just be fair, we all get whatever everyone think. I'm not sure if you guys
I agree with that.
I agree with Krisa.
Me too.
Let's make it a learning experience instead of a competition, and that way we all get points and we can use them for grades.
Yeah.
For the F4.
Okay, so yeah.
Except group F.
What's the group? Why group F?
What? What are you saying? What? Except group F? Dr. G?
No. No, all the groups are going to be the same.
One down.
Thank you.
Props to Krissa, because you're on your own and you've been handling this like a boss.
Yeah.
I know, Krista. I was about to say that. Oh my God.
Good job. You did great.
I would have been had an anxiety attack.
I'm already having, even in the group.
Well, thank you guys.
She did
Thank
this.
you.
Good job.
Good job, Krisa.
Okay, by the way, I need to add all this summation here. So I go every here. What is this? What is spill? Oh my God. what is happening? Okay. Oh, okay.
Still some points here and there to everyone.
Sorry, I spilled my milk.
Oh my God, Joel.
What is this? I never saw this spill coming in any. No. All right, so let's see how many we have here. The mnemonic is going to decide, I guess, right? So now the next activity is the mnemonic. I'm going to add the attendance for break number 4. Let me make the summation of everything here. And thank you for your understanding, guys. So
It's been fun, honestly. It's been fun, this boot camp.
Yes.
This is the first one. We are going to make some adjustments for next time. And I will tell you something at the end. Just a moment. So we are going to. Okay, so this is a summation. Perfect. So yeah, it looks like it's more even. So break 4. Everybody's here. Somebody left.
I'm still here.
Kimberly, are you there?
Yeah, she's connected.
She's connected.
I am here, Dr. G. I'm here.
Oh, you're here? Oh, okay. Well, okay. Lady, it's here.
Yes, I'm here, Dr. G.
Excellent. Krisa, yes. Ruby, yes. Fidel, yes. Cheyenne, you look a little quiet today. Are you there?
She left.
Altia?
I'm here.
Montserrat?
I'm here, Dr. G.
Thank you. Cyril?
Present, Dr. G.
Thank you. Anila?
Here.
Ismael?
I'm here, Dr. G.
Okay. Miss Rebecca?
Here.
Group F left.
We are here.
Yeah, Joel wasn't it? Was in our group.
Mr. Miguel?
Joel?
Miguel, is there? Miguel?
Yeah, he was still connected.
Okay, so
Dr. G is at work. Probably he is not listening.
okay, Samna, you're here, right? So I'm going to
Yes.
give you a couple minutes to Miguel to come. Okay,
Yeah, let me text him.
2 minutes.
A customer. That's why he's not answering now.
Yeah, he's here.
Okay, all right. And Cheyenne is here. Just to give the same chance.
No, she left, Dr. G.
Okay, all right. So average is what is counting. So who is leading is group A, and group B, group Anila, Claudia, and Kimberly. Everybody's close. So we are going to do this is going to be, okay, so it's consolidate that, the mnemonic. So what is in our calendar? Mnemonic, what time is it? It's 2:05. 2:05. So let's have a 10 minutes break and we are going to do the mnemonic test, a contest. In the mnemonic contest, I will tell you, everybody's who showed me a mnemonic that is easy, short, and that see that we was having some elaboration there is going to receive points. Okay, doesn't, so it's not really, we don't have a winner mnemonic. So all mnemonics are going to be accepted, and we are going to pick up which one we like to use for our lectures. Okay.
Dr. G, is it only for the slides or just any pharmacology mnemonics?
Any pharmacology mnemonics, or from the slides too. So whatever pharmacology mnemonics is.
Dr. G.
Oh, yes.
Just anything, right?
No, whatever, no anything, but something that is going to be useful for us. So
Okay, thank you.
okay, all right. So remember, okay, I go ahead because I know many mnemonics. I know that where it's coming from. So be careful because of that. Okay. All right. So I will see you in 2:20, just to make some break here.
Thank you.
Thank you.
Okay.
What time do we come back?
2:20.
2:20?
Yes, 2:20.
Anyone can answer my question, please. Are we doing the mnemonic on the super slide or anything on pharmacology?
Pharmacology.
I think it's on anything.
Anything on pharmacology.
Yes.
Yeah.
Thank you. Thank you, guys.
Okay, hello. We are going to do our mnemonic contest now. For this, we are going to continue with the same groups, group A, B, C, D, and E, and F. And we are going to, this is an open kind of conversation. So I would like to know if I can start by groups, or I can wait spontaneously you to tell me which mnemonics are, and we can discuss about that. Okay. All right.
Yes, Dr. G.
So let's start. We have let's start with group A. Group A. I have Miss Corpus, Mr. Joel, and Miss Lady. So will you have some mnemonic that could be fun, or something that make us remember things? What in your study do you find something?
I did. So, drugs for bradycardia and decreased blood pressure. Mine was IDEA, and it stands for I can't say this one. Isoproterenol, dopamine, epinephrine, and atropine. So IDEA, and then
Epinephrine and atropine. Okay, let me write down that. So that is what is isopropyl? What is dopamine? What is epinephrine? And what is atropine? Idea, right? So, Miss, what do you think? She give a title of bradycardia. So, what do you think about that? Hello.
We're here, Dr. G.
So, isopropyl, dopamine, epinephrine, and atropine. What are doing these guys? So where is it from, the lady?
they increase the heart rate and the cardiac output, causes bronchodilation.
Yeah. Isopropyl. What is isopropyl?
It's a beta-2-adrenergic receptor.
Okay. Dopamine.
Norepinephrine. It causes norepinephrine to be released.
And epinephrine, the same. And atropine. What is atropine? Is cholinergic or anticholinergic?
Anticholinergic.
Anticholinergic. And what is the effect on the heart?
Acts on smooth muscle of the heart and increases cardiac rate.
Cardiac heart rate. Okay. So yeah, I think it's a good mnemonic. What are the use that we can apply to this, for example? So just to remember the names that who can actually produce increase of heart rate, because the treatment for bradycardia is not exactly this medication, but just to remember, yes, it's going to be okay. So isopropyl is alphas, adrenergic, epinephrine is adrenergic, dopamine is a vasopressor, right? Increase a vasopressor, contractility too, and atropine is an anticholinergic. Okay, so that is a good idea, just to see that these medications can increase the heart rate.
I also had one for TB, but would you just like me to say one for now?
Yeah, let me check. Let me see how many contribute here. You are a group A, right? A, one. And do you have another one?
Yeah, for TB drugs.
TB drugs, okay.
So the mnemonic is RIPES, and it stands for rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin.
So, and again, what is the word? Vibes?
Ripes?
Ripes. Okay. Right.
Yeah.
So rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. Yeah, there is that is a very. I mean, you get it from just reviewing your because this is kind of common. They can use ripes or I use priest. I use priest because I didn't want to use ripes because I knew that ripes is there. But I'm sure that you found it in your study, right? So you was trying to memorize. You don't need to use my mnemonics. You can use your own ones, right?
Yeah. Okay.
All right. So that is ripes. Okay. So we have that one. Very well. Now, Krisa, if you have one more, just let me know.
Well, I have signs and symptoms of right-sided heart failure, and that's swelling.
Swelling.
So, yes, so S for swelling of the legs, W for gain weight, E for edema, L for large neck vein or JVD, L for lethargic, I for irregular heart rate, N for nocturia, and G for GERT.
G for what? For GERT. Oh, GERT. The GERT. Yeah, GERT. So what is the word again, please?
Swelling for signs and
Swelling.
symptoms of right side heart failure. Right side heart failure.
Wow, that is a good one. I never heard about the swelling, and actually, swelling I mean heart on fluids, right? Heart HF, heart failure, heart on fluids, swelling is going to be. Again, swelling is S, swelling. W is what?
Weight gain.
Weight gain. E is
for edema.
edema. L.
L is for large vein. Oh, sorry, large neck vein or JVD. L is for lethargic.
Mm-hmm.
And then I is for irregular heart rate. And N is for nocturia, and G is for GERT.
GERT. Yeah, very good. So somebody comment about this?
Yes, that's a good one. Usually I have issue identifying signs and symptoms for heart right side and left side. So now that's a good one. I'm going to take that. So
yeah.
Thank you, Krisa.
Very well, very good. Krisa, another one. You want to wait?
Honestly, Dr. G, that's the only one I have. I thought I would have partner, but yeah.
Okay, Krisa. Okay.
Sorry.
All right, so let's go to Miss Ruby Guevara, Fidel Romero. I know that Fidel have a good imagination to create mnemonics. And Cheyenne. Okay, go ahead, please.
I have no imagination.
No imagination this time. No, you. So, do you have some mnemonic for us, Fidel?
We have 3.
Excellent. See, I knew it. I knew it. Go ahead, please.
Okay, I guess I'll start with it though. So one of them is actually short. We've got too cuties say no to obese. The cutie stands for quinolones and tetracycline because they're contraindicated in pregnancy. And that's why it's too cuties say no to obese. Obese is in, pregnancy.
Okay. All right. So, can you write down the word in the chat just to be because I.
Oh yes.
Yes,
please.
please.
Please, Ruby.
Okay.
Oh, okay. Lady, you're going to tell me again, please, okay?
Okay.
Two QTs say no to OBs. That is the one?
Yes, I know.
Oh,
Which was
okay.
because I think it's
I, I,
funny.
I want to hear about that.
So yeah, QT, Q stands for quinolones and T is tetracycline, and they're contraindicated in pregnancy. That's why OB is in pregnancy.
Okay. And the two TWO is just QTs.
Yes.
Oh, but the two is not mnemonic. It's yes, QTs, no OB.
Just QTs.
Oh, okay. That is the quinolone, right? What you said is a quinolone, yes.
Quinolone and tetracycline. It's kind of like, there's two cute guys who see pregnant girls. I think that's what and
Excellent.
that's why two cuties say no to OBs.
QTs, no to OB. QTs, no to OB. That's a good one. That's what I like it. Yeah.
We have another one that's drugs for bradycardia and decreased blood pressure.
Okay, so let's see. Bradycardia and lower blood pressure. Okay, go ahead.
Oh, that one's done already, actually.
Oh, that one is there?
Yes.
Oh, yeah. Then we have emergency drugs to lean on.
Okay, let me write down. Emergency
drugs
to
lean on.
Okay.
And it's a double A.
Oh, lean. Oh, yeah, I guess. Okay, so tell me, yeah, elaborate.
So L is for lidocaine. E is for epinephrine. The first A is amiodarone. The other A is atropine, and the N is Narcan.
So those are drugs for emergency.
Yes.
Yeah, because lidocaine, what is lidocaine is antiarrhythmic, correct?
Antiarrhythmic, and it could use, it says anesthetic too.
Yeah. Okay, so you mentioned something. When is going to be anesthetic? When is going to be for in general?
So when you want it used for anesthetic is for for suturing, when the patient is going to get sutures.
Yeah, but this lidocaine is going to be lidocaine is going to be used with epinephrine. Okay, so I will explain you. The lidocaine is derived from the cocaine. That's why you see that this kind of anesthetic. So people who have they smell the cocaine. They don't have like a numbness on the mouth, on the lips, and the nose. Right? This is actually anesthetic. And what happened is that in the nose, when they smell the powder, whatever, it produces vasoconstriction, and that is enclave, by the way. And that vasoconstriction is going to make the necrosis of the septum of the nose. So you have perforation of the septum when this sniffing of the powder is for a long time. Now, this lidocaine have properties for antiarrhythmics. Okay, so it's going to be decreasing the heart rate. Now, lidocaine you can apply in the skin for stitches, but this lidocaine is going to be metabolized and absorbed very fast. So it's not going to last longer. So what they do is to give the lidocaine with the epinephrine. And this combination, what is doing at the moment you inject in order to make stitches, the epinephrine is producing vasoconstriction, making the lidocaine stay longer in the tissue. Make sense or not?
Yes, makes sense, Dr. G.
Right. So, and one thing here that is important, and thank you for mentioning that, is that this you need to read carefully the label. if you have some patient with arrhythmias, heart rate increase, right? You're going to give lidocaine alone, and the bottles are very similar. So lidocaine plus epinephrine is only for stitches. You cannot give epinephrine somebody who have arrhythmias. Yes or no? It's going to be worse. Correct? So that is an English
Yes.
question. So you need to be careful to read. So when you have we call xylocaine. Xylocaine is lidocaine plus epinephrine. So that is for stitches, local anesthesia, right? But when it's lidocaine alone, that is going to be basically the antiarrhythmic. All right, so you put me here drugs that are being used in the emergency room, right?
Yes, I heard for emergency settings.
Okay.
And like you said, for epinephrine, you don't want to use that for
And what is
if
A?
patient is having arrhythmias. We have two A's, atropine and amiodarone. Um, they can both be used for antidysrhythmias.
You know what? You know what? I like this mnemonic. I really like it because definitely you are targeting exactly the drugs that all emergency rooms should have. They don't. They should have all these plus the crystalloids, etc. Right? But these five are going to be very important. Yeah, those are actually for emergency room. Very well. Thank you. Very good question. Very good mnemonic.
Thank you.
We also have another one for, but this one I don't know if you want us to say it because this is more on like for assessing the heart, like for listening the heart sounds.
Okay, so you can share that. That is not pharmacology, right?
Yeah, but if
Yeah,
I mean if you
I would like to share. I would like you to share that, please.
it's because this it should be the correct order when listening is the mnemonic is all patients take medicine.
Okay, elaborate, please.
The all is for aortic, patients is for pulmonic, take is for tricuspid, and medicine is for mitral.
This is for assessing heart sounds.
All patients taking medications. Okay, that's a good one. It's totally yours, Fidel.
No, this is not mine.
Oh, but very good eye because that is a good one. Yeah, the aortic, pulmonary, tricuspid, and mitral. Right. So that's a very good. Uh, I'm not going to include that in a mnemonic for pharmacology, but actually I like this mnemonic. So at the beginning, you can use this mnemonic to check the order of the auscultation. Very good, excellent, very good, excellent. So somebody else, your group have another mnemonic. You have emergency drug to lean on, QTs, and you have all patients taking medicine. Very good. I want to go back to Lady before we continue to Group D. You have another mnemonic, Lady, right?
Yeah, for lidocaine toxicity.
Oh, that's what I was gonna say too. Never mind.
Oh, wow.
SAMS.
Okay.
Sam.
Yeah, it's S, slurred or difficult speech. A is for altered cardiovascular system. M is for muscle twitching, and S stands for seizures.
SATS?
No,
SAM.
Sam.
So M is muscle twitching.
Oh, SAM.
Mhm.
Lidocaine toxicity. Okay, lidocaine toxicity. So SAM, right? SAM is a slurred speech.
Yeah, we could elaborate more because it says paresthesias and numbness of the lips or tongue.
It has like little symptoms under it.
Alterations on cardiovascular. What alteration on cardiovascular?
Drowsiness, dizziness, arrhythmias.
Why this? Because this is actually to decrease the heart rate, right? M is muscular what?
Muscle twitching. We put muscle twitching for tremors basically. And seizures was respiratory depression and respiratory cardiac arrest.
And the other S at the end?
Oh, sorry, that was for the last S. For the first S, it's actually slurred or difficult speech, and that was the numbness of lips and tongue, the paresthesias. And then the last S was respiratory depression, respiratory and cardiac arrest.
Yeah, but you said S. What is the S? Where is the S there?
So SAM. So S for the first one, it's slurred.
It's not SAMS. It's SAM only.
It's SAMS because the last S is seizures. And then the first S is slurred or difficult speech.
Yeah. You know what? English, they ask you about lidocaine seizures. So you got the one there.
Okay.
Okay, so I'm going to put a star here. Very good.
I think we might have another one.
You have another one? Okay. Go ahead.
Dr. G, don't forget other groups.
No, yeah, I'm going to go to DEF and then be exclusively for D, E, and F. Okay. Okay. Okay, Fidel, go ahead.
Okay, so we have aches.
Apes?
Aches. ACHES, like when you're aching. Aches.
Okay.
Here, I'll type it, sorry.
What is that?
This is for some nursing considerations, like what to watch out for oral contraceptives. So A for abdominal pain, C for chest pain or shortness of breath, H for headaches, E for eye problems, and S for severe leg pain.
Severe what?
Severe leg pain.
Leg pain. Leg.
Yes, and these are for when you're taking oral contraceptives.
Okay. So I will, yeah, apes, aches. Sorry, apes, no aches. Why is that? See, you can explain that with retention of sodium and water, right, of the estrogens. So that is your third mnemonic, correct? Okay. All right. So now let's go to group D, E, and F. So please, Altia, do you have your mnemonics? You have some mnemonic there?
I have something for asthma, Dr. G.
Oh, okay. Let's go.
So, treatment for asthma, I have asthma. It's A for adrenergic agonists, S for steroids, T for theophylline, H for hydration, M for mass oxygen, and A for anticholinergics.
Yeah. I know this mnemonic in the past.
You know?
Yeah, but you just created, right? You found it yourself?
Yes.
Type
Okay.
it, please. Yeah.
Yeah, so that is what is valuable. Yes, if you study, you find your own mnemonics. That's what you're going to use. All right. So what is what? Who said what is means?
Oh, Dr. G, sorry, that was me.
Okay. All right. So let's go to group E, please.
Wait, Dr. G, I have some.
Oh, okay. Go ahead.
So for congestive heart failure, it's unload fast. U for upright position, N for nitrates, L for Lasix, O for oxygen, A for ACE inhibitor, D for digoxin, F for fluids, A for afterload, S for sodium restriction, and T for tests such as digoxin level, ABGs, and potassium level.
And what is the word? Load fast?
Unload fast.
Unload. Oh, I never heard that. Unload. Is it for cardiac heart failure, right?
Yeah.
Can you repeat again? U, what is U?
U is for upright position.
Why upright position? What is N? N? Hello, N? What is N?
Oh, nitrate, sorry.
What is L?
Lasix.
Yeah. What is O?
Oxygen.
What is A?
ACE inhibitors.
What is D?
Digoxin.
Mm-hmm. What is F?
Fluids.
Fluids what?
Decreased.
Oh, okay. A?
A for afterload, decreasing afterload.
What is afterload?
It's a pressure in the aorta.
Pressure of the contraction of the heart, right? Okay.
Yes.
S, what is S? S, what was it?
Oh,
Upload.
sodium restriction, just because the patient's already taking furosemide for Lasix.
And T?
Tests such as digoxin level, ABGs, and potassium level.
Okay. All right, so that's good. Thank you. Thank you. I have it here. So probably going to, if you can mail me that, I will post it on the as a result of our session today. I want to hear from Anila, please. Anila.
Yes, Rebecca is presenting.
Oh, Miss Rebecca. Okay, Miss Rebecca, please.
Can I share my screen? I think that might be easier. I have it.
Yeah, absolutely. Let me move out from this.
After they're done, Group C has another one.
Group C another one.
Yeah,
Okay.
Group C has another one too.
Everybody, okay, you're right. That's okay.
We actually have two.
Okay, can you see it?
Yeah.
Okay, so the first one, Anila made this one. It's for digoxin. So I for inotropic negative, C for chronotropic positive, and E for assessing the eyes for if they see a halo or yellow-green colors.
Who made that?
Anila?
Anila. Wow, I like that very much. Okay, let me write it down. Digoxin, inotropic negative, chronotropic positive, eye hello, yellow green. Very good. I like that. So that is how you remember how we do that is basically what is digoxin, right?
Mm-hmm.
Negative, chronotropic positive, and eye hello, yellow green color. Those are the side effects, right, of toxicity levels of digoxin, correct?
Yes.
And remember, in addition, NCLEX, they like to ask, I need to mention this, that the first signs and symptoms of digoxin toxicity will be nauseous and vomiting. Nauseous.
Oh,
But,
look, I can put it in there.
oh, but you cannot make it there. You don't. Nice. Oh, nice.
Yeah, it's nice.
Nice. Nauseous. Okay.
The next one is magnesium sulfate toxicity. You kind of mentioned it when we were going through the slides. So you would check for blood pressure is decreased. So sorry, the mnemonic is burp. So it'd be blood pressure is decreased. The urine output is decreased. The respirations are less than 12. And then the patella reflex is absent.
I like it. Blood pressure, urine output, decrease. This is your second mnemonic you give me, right?
Yes.
A respiration less than 12, and patella reflex. Excellent. That is very useful, huh?
Yeah.
Digoxin, magnesium sulfate are very, so please, everybody can use that. It's very nice. So the rest too, all of them are very useful, but this is very NCLEX, very HESI, yeah? Very HESI.
The next one is cholinergic side effects.
So
And
how many we have? 3, 4.
we have a lot.
4? How many? 4, 5?
Let's see, 1, 2, 3, 4, 5, 6, 7. Sorry.
Okay. All right. Okay.
So we have sludge for the cholinergic side effects. S
Yeah.
for salivation, L is lacrimation, U urination, D diarrhea, G is GI upset, and E is emesis.
Uh-huh.
For benzodiazepine actions, we have SAM, S sedation, A anti-anxiety, A anticonvulsant, and M is muscle relaxant. For Lasix, we split up the word Lasix because it lasts 6 hours.
Yeah. Actually, that is at the beginning they was thinking they last 6 hours, but now they know they last only 4. So
Oh, oops, just kidding.
no, that's okay. But definitely, yeah, they was the name is coming from last 6 hours. So that is what they was putting at the beginning. But now we know this last only 4 hours.
Okay, I won't use that one. And then this is MedSurge. I don't know if you want me to use these.
Yeah.
Okay, so for nursing considerations for bronchodilators, we have the mnemonic is breathe. B for breathing and coughing techniques. You want to teach that to the patient. You also want to teach relaxation techniques. You want to evaluate the heart rate and blood pressure. A is for assessing the lungs. T is for assessing for tremors. H, you want to tell them to have 8 or more glasses of fluids. And then E, you need to emphasize no smoking.
Mm-hmm.
And then for assessing depression in the elderly, we put SAD. S is they're staying in bed more than usual. A is they have an attitude change. And then D is decreased appetite.
Yeah, that's a good one. The elderly is a good one.
Yeah.
In conclusion, the elderly, whatever they have habits, they have actually routines every day. Whatever is you see any change, whatever change, that means that something is going wrong with that patient. Very good, very good. All right, so let's go to group F. That is Miss Claudia, Mr. Miguel, and Miss Sabna. Please go ahead. Take your time.
Claudia,
Hi.
type that first one.
Yes, I sent it on the chat box. This is one for chalk, for the different types of chalk that we have. I have CHAMPS, which is for C for cardiogenic, H for hemorrhagic, I cannot say it, for hemorrhage. A for anaphylactic, M for metabolic, and then the P I put hypovolemic, and S for septic shock.
Yeah, actually, I love this mnemonic. Very, very chumps. Very, very easy for.
Yeah, and it's very easy
Very
to chalk and champ, which is about. It sounds almost not the same, but it's.
Well, just a moment, just a moment. I want to see something. C is cardiogenic, H is hemorrhagic, A anaphylactic, metabolic. There is metabolic shock. It's a good name, but this I never heard metabolic shock. Probably you can do it. Hypovolemic shock. No.
Mhm.
Yeah, but it's not M. It's going to be all right, so that's okay.
So then it will be chops.
No. That is research. This is not pharmacology.
Do you
So
mean metabolic acidosis shock? Is that what you're talking about, or no?
metabolic acidosis shock? My God, no. What is that? No. When you have a shock, hypovolemic shock, whatever, basically you can lead into metabolic acidosis. But no, there is no such metabolic shock. I never heard that. So we need to.
Let me revise that, Dr. G.
Yeah, let's revise that. But very good intention. I like it. I like it seriously. Another mnemonic
For any group or for the same group?
for group F.
I have something for INH, isoniazid, and it's because it's for tuberculosis. So it's tuberculosis belong to lungs. And L for liver enzyme must be monitored. U for use cautiously with renal dysfunction. N for no alcohol. G for give pyridoxine to prevent peripheral neuropathy. And S for should take an empty stomach, screen vision.
Okay.
Yeah.
Very good.
Then I have another
Who
on
is this? Samna?
Sapna. Yeah, sulfamide for sulfa, and the mnemonic is also sulfa.
Is what? Is what? Sorry.
Sulfa, SULFA
Okay,
for
sulfur.
sulfamide.
Okay.
Yeah. S for sunlight sensitivity, UE means U for undesirable effect, rash, renal toxicity. Then L for look for urine output, fever, sore throat, and bleeding. F for fluids, Gorels. I saw. I cannot pronounce that. Sorry. And A for anorexia and anemia.
Those are side effects of what? Of INH.
No, 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 no. INH was only lungs. It's for sulfamide, Dr. G.
Oh, so okay.
Sulfamide, sulfa.
Yeah. So S, what is that? Steven Johnson, you said?
No, no, no. I did not say that.
Oh, what you said? S. Can
I
you repeat?
as for sunlight sensitivity for
Oh,
sulfamides.
okay. Okay, got it. You?
Yeah. U for undesirable effects like rash and renal toxicity.
Okay. L.
L for look for urine output, fever, sore throat, and bleeding.
Wait. Just a moment. L. Urine output. Where is the L there?
Dr. G, look for.
Oh, look for. Oh, okay. Okay. All right.
F for fluid galore. And A
Okay.
for anorexia anemia.
Okay. Anorexia anemia.
Yeah.
Okay, so I have counting the mnemonics that we are going to apply, and let's see.
Dr.
So
G,
group A. Oh yes.
it's Claudia. Can we use it like champs without the M? Neurogenic is the other one for
Yeah.
type of talk.
Chunks. Chunks.
Yes, instead of the M, the
Mhm.
N.
Yeah. So, but that is for med search.
Yeah.
Yeah, that's good. Yeah, yeah. I will. I will like. I will consider that for med search. Okay. Very good.
Yes, Dr. G.
Tell me, okay, so I have on my contability here, we have we have 3 mnemonics. Is that right? Right? Okay. I have 9 points there. For Miss Krisa, I have 3 mnemonics. Is that correct?
No, I only have one mnemonics, which is I think
Really?
3.
But you put me here swelling. Oh,
Yes.
yeah, that is med search. Yeah. So only one, right?
Yes.
Yeah. Okay.
Well, I have another one which is leak on the can for diuretics. I'll type it in the chat box. But I'm not sure. Hold on.
Okay, so I will see that at the end. So let me finish this, and then I'm going to ask everybody to have the same opportunity. Now, give me a few moments, please, Krista. Ruby, you have Group C 2 mnemonics, correct?
And we have 2 more that we want to say.
Okay, all right. We are going to see that in a few moments. Altia, you have 2 mnemonics, correct?
Yes.
We
And
have
Okay.
we have 3 more, Dr. G.
Now multiplying the mnemonics now. What happened? Okay, so
More.
then we have Anila. Anila is group E. You put me 5 mnemonics?
7.
All of them were pharmacology. Let me remind me.
We had 8, and the last one was med surge, so 7.
Wow. Okay, Anila. Miss Claudia, how many you have?
3, Dr. G. But one, she said it was going to be for med search.
Yeah, okay. All right, so last chance. So we are going to finish in a few moments, okay? So the last chance, no more mnemonic. So Kimberly, mnemonic, yes or no? More mnemonic or no?
No, I think that's it.
Okay.
I have something for bioscience for you, Dr. G.
Okay, bioscience, okay. Okay, so we can probably if we have another session, we are going to include that next week probably. Krisa, are you okay with that?
I'm okay with that. Yes,
Okay.
I'm okay with.
Ruby,
Oh, we have 2 more.
2 more. Okay.
Yes.
3.
Oh, we have 3 more.
Okay, 3 period, no more. Okay. Okay, so give me the first one.
Okay. One of them is very simple. It's just mom in the PM for a BM in the AM.
Okay, can you write down that please, because I pulse particular arrhythmia. Who is this? Oh, okay. So sotelol. What is sotelol? Okay. Mom in the PM for BM in the AM.
Do
What
you
is
think you can guess what that is?
mom is a mom looks like to me like laxative.
Yes, that's right. It's milk of magnesia.
Laxative in the PM. In the PM, you want laxative in the PM. And BM in the morning. Oh. Okay, what does it mean?
That's it. Pretty straightforward. You give them milk of magnesia in the PM, so it doesn't work right away. So that in the morning when they wake up, they go. So mom in the PM, so that they have BM in the AM.
Okay. Ruby Guevara. Okay, so I'm going to give one Ruby Guevara 9. Okay, so
And Fidel has one more.
all right, so I think it's enough for today. We are already finished.
Oh, no, Dr. G, we have more.
Dr. G, I need the points.
Dr. G, you cut us off. We weren't finished.
And I'm saying that.
Yeah.
Mnemonic than us, please.
Okay, Montserrat. Yeah, I want to hear Montserrat, please.
Okay, I'm gonna present my screen, Dr. G. This is Cyril.
Okay.
Can you guys see it?
Yes.
Yeah.
Who is this? This
Cyril, Dr. G.
Cyril, okay.
So I have 6 more mnemonic that we made. So for the left side heart failure, think of left, think lungs.
Yeah,
so
but
we came out of drowning.
mhm.
So dyspnea, rails, orthopnea, weakness or fatigue, nocturnal paroxysmal dyspnea, increased heart rate, nagging cough, and gaining weight. That's our first one. Our second is if you think of iron rich food, just think of eat lots of iron. So egg yolks, apricots, tofu, legumes, oyster, tuna, seeds, potatoes, F for fish,
Mhm.
I for iron fortified cereals, R for red meats, then the poultry and nuts. Then also, I have sign and symptoms of hyperkalemia in potassium imbalance. I came up with a murder. So M for muscle cramps, U for urine abnormalities, R for respiratory distress, D for decreased cardiac contractility, E for ECG changes, R for refluxes. And Altia? Are you there?
Oh, yeah, I'm here. So I already presented the congestive heart failure, which was the unload fast. And then we also have the pulmonary edema, which is mad dog. M for morphine, A for aminophylline, D for digitalis, D for diuretics, O for oxygen, and G for blood gases. And then for ventricle arrhythmias, we have PALS, which is P for procainamide, A for amiodarone, L for lidocaine, and S for sotalol.
Sotalol. How new is the sotalol? Okay. All right. So
All right, that's it.
okay. So from all of these, I'm going to consider only what is related to pharmacology. Okay. So total, I have 3 more. Okay.
All
So
right.
it's going to be 9 plus 9, 18.
Thank you.
Okay. So we finished with group A. Let's go with group B.
No more, Dr. G. I answered earlier.
Okay.
That was actually group A. That was not
Yeah,
group A.
that was group D. So
And
you
That was group D. Please
And
make
group
sure you put it on group D.
Oh, group D was the one who gave me all these mnemonics?
Group
Yeah.
D as in dog.
Yeah. Oh, D. Sorry. Okay. D as in okay. Don't get upset with me, please. This is correct. Okay.
No, sorry, Dr. G. I don't mean to give attitude.
No. It's not that. I'm not. Ruby. No more mnemonics.
group what?
Ruby. Fidel.
Fidel,
Yes,
you can say it.
you just cut us off though last time.
Okay.
So
Oh,
did we
okay. Go ahead. Go ahead. Go ahead.
we
Oh, yeah.
have
Okay, go ahead. Go ahead.
okay, so we have the 4 A's for aspirin,
Stand before.
anti-inflammatory, anti-pain, antipyretic, and antiplatelet aggregation. And we have ORDs for alpha blockers.
Okay.
And these are orthostatic hypotension, reflex tachycardia, dizziness, and sexual dysfunction, inhibition of ejaculation.
Okay. That's a good one.
And I take
ORS, right? ORS.
ORDs
ORS. Okay. All these. Okay, got it. ORS. Another one.
in the chat box.
I also have one for PPI side effects.
PPI side effects. Okay.
So the mnemonic is KFC. The first one is kidney. All PPIs are associated with acute interstitial nephritis, and that's why the K is there. And then we have F for fractures, and then C for C. difficile infection. I don't really know how to say that one.
Difficile.
Yeah.
They know that a PPI can increase the risk for pneumonias, and they can increase risk for C. diff. Yeah, that is true. All right, so we finished with that group. We have 3 new and
Acetaminophen, but
yeah,
that one is too long.
we need to finish the 3, 9, 18. Okay.
What was that?
Dr. G, the last one was said by Lady from Group A.
Oh, that's what I'm doing. Oh, okay.
It's 2 more mnemonics for group C and then 1 more for ladies group.
Yes.
I wanted to share
Okay,
acetaminophen.
so 9
but-
plus 3 is 18, and 1 for ladies group 12. Okay, 3. Okay, we got it.
I also added one, Dr. G, for
Which one?
pharmacology. I don't know if I am pronouncing it right, but
Which is-
for
which-
Claudia,
Ah,
Group
Claudia.
F. For upper respiratory infections, the 3 medications that we use
Which one?
is AMI, like antitussive, mucolytics, and expectorants.
Uh-huh. Okay. So just say AMP. So anti.
AME,
Uh-huh.
AME,
Oh,
antitussive, mucolytics, and expectorants.
AIM. Okay. All right. So with that, we finish our sequence. Okay. All right. So we complete that. So thank you so much for these mnemonics. I'm going to use some of them with your permission, of course. And because you create a mnemonic is like a half, probably like a small kid, and not baby, right? Yes, actually you create that. Okay, so let's continue. So what is next in our agenda is going to be I'm going to pass attendance for break number 5, sorry, and we are going to have the HESI exam. The HESI exam is going to be 55 minutes. So you want a break 10 minutes, or you can start now?
Please, Dr. G, I need a
I
break.
want to start now because I have to leave.
Yeah, but yeah, basically we need to follow the schedule. So I'm going to open the HESI practice exam now. Okay.
Okay, thank you.
All right. So let's go to here. Practice exam here. It's going to be sequential, as you know, right? This exam is going to be sequential.
Do we get points?
No, you got the grade, but it's just practice. It's not part of the main course.
So it's just test our knowledge.
Yes, it is. Where is the sequential? Oh, I said, where is the sequential? Where is the sequential? There's no sequential. Free. Oh. What is the scene? I'm going to enable. Okay, what is the password? Okay, the password. So you can go into the exam, please. Go into what? Into HESI practice exam here. It's below Super Slide Contest 1 and 2. HESI practice exam. And yeah, and the password is the number 3. 3.
It says back to course, Dr. G.
But to what?
It says new questions have been added.
Questions have not been added? Are you
Yeah.
kidding me? Oh, okay. That is no good. Okay, so let me add it. Where is my? This is this one. It's strange. I thought I did it. Okay. Let me go here. Just a moment. Let's do this. $55. How many? 100 divided by 55. How much?
It's 100 questions?
No, 55. 1.81. So just give me a second. Meantime, you take your break. Until I finish too, because I thought that I was set, but it's not. All right. So
Is it for 10 minutes?
yeah, in 5 minutes I'm going to be ready.
Okay, thank you. You're not having your coffee today, Dr. G?
Hmm?
No coffee?
Copy? What do you mean copy?
Not coffee, coffee.
Oh, coffee. No, no, no.
You look tired now.
I'm tired. Yeah, I'm tired. It's because yesterday I was preparing all this yesterday, and was not perfect as I was expecting. Was not perfect.
It's good,
Yeah,
Dr. G. It's first time, right?
yeah, first time.
It's still better. Don't worry about it.
Thank you. Okay, let's see. Where I am. Okay. Mm-hmm. Okay, so I think we are ready. Yeah, we are ready. You can start, please, your exam.
All right. Thank you.
The password is the number 3.
Okay, Dr. G.
Proctor, Dr. G?
Oh? No, it's not Proctorio, no.
Okay.
It's just practice. It's not going to be in the exam. Oh, it's not going to be the grade.
Okay.
Can you repeat the password, Dr. G?
The password is the number 3. 3, 3. 3. Okay, so tell me who is in.
I'm in, Dr. G.
Excellent. Excellent. So you have 55 minutes. So, okay, I will see you at 3:20, 55, 5, 75, 4:15. About 4 p.m. we are going to start. Okay, so focus, please apply everything that you got. Make this last effort, and we are going to see the results after. Hello. Did we finish?
Yes, Dr. G.
No.
Okay.
Almost done, Dr. G.
Okay, all right. I'm going to put attendance. The degree, oh, this is 1 point. 3 points. So I need to correct that. Oh, God. I get 3 points here. Point. Oh, but somebody didn't come. Okay. It's 1 point.
Guillermo. Guillermo.
Okay, guys. Oh, we still taking some. Yeah, let me know, please. Monserrat is still. Miss Carissa. Okay, so let's wait a few more minutes.
Dr. G, I joined through my phone.
Yeah, okay, Fidel, good. Thank you.
Yeah, I have to get going to work.
Okay. Yeah, we need to wait until everybody's finished. So we are going to do the personal study plan. We're going to do the debrief. Fidel, can you please fill up the survey ahead of time?
What survey?
The survey at the end of the page before you go.
Oh, I already kind of left, but here, let me.
Okay.
Can I access it through my phone?
I don't know. You have Word. You can open Word and make a file and upload it.
Can I turn it in tonight?
Yeah.
Okay, yeah, I'll do it tonight because like I said, I'm on my phone and I need to get going to work.
Okay.
Yeah,
Sure.
but I'll still be able to be in the class.
Yeah. Okay, Fidel. Do whatever you need to do, mister. Thank you. Thank you. Thank you. So it's going to be closed in 15 minutes and 15 minutes in 4 minutes. So then we are going to do the study plan and then we can finish at 4:30 sharp, most likely. I just need to tell you something about the practice exam HESI right now. Tell me, what topics that you didn't see yet, right?
A lot of them, Dr. G.
Okay, good. So I was calculating that whatever you grade is here, you need to add 30%. 30%. Okay, I was doing the exam, and yeah, there's topics that you didn't know, but there's a reason for that.
Yeah.
So if you feel okay, so
on a real note, it was really hard.
Yeah, I know, it's very hard.
Very hard.
I couldn't find it harder than that.
Oh, you made it hard for us.
Yeah, definitely. So definitely when I was taking my exam for NCLEX, for USMLE, for the medical doctor, I was just freaking out because all the tests I was buying, I was having like 50%, 60%. But then at the end, they told me after just suffering on that, like for a week, I find out that these grades represent lower than so they make it harder in order to have a very good grade in the USMLE. And definitely this is like 30% more. So that's what I calculate about. That is more 30 points. Whatever grade you have 30% more. And for this, what I'm trying to tell you is that pharmacology. My conclusion about this exam is, I'm happy with your results. Huh? I'm telling you, because it was hard. And second, we never learn. There's no one in the world they can tell that they know everything about pharmacology. No, there is no one in the whole planet that can tell that they know everything about pharmacology, because it's not true. And pharmacology is not just a course. Pharmacology is a lifetime study. So new drugs are coming, new drugs are going away, new medications appear, new side effects are being discovered. So then discovered that can be in the long run. So there is many changes. So my purpose of this exam was just not to make you down, but the opposite, that you are in the right way. Nobody had me 10% or 5% in the exam. This exam was hard. And yeah, so the only thing is I want you to be encouraged, to encourage you to keep studying. This is not because attending or is not enough. You need to do still your own work on your side. And the news is that we are going to still helping there. So apply. How many of you apply the concepts that we was learning in the morning? Probably you forgot, or probably unconsciously you was doing the same thing that you was doing in previous exams. So I'm really happy with those results. I'm telling you. So from now on, you need to apply more and more of what you learn in this 8-hour session. Okay. Okay.
Yes,
all right. So it's just not to go to the sky, but we need to step on the reality. Okay. So, and definitely you're doing the right way. You're in the right pathway. I'm telling you. Okay. So I think we finished already. Let me see if hopefully everybody hear what I was saying. Yes, everybody finished. Okay. All right. So at this moment, what I want to tell you is this: I already checked the grades, and I'm very happy with those grades. Even though somebody have a 50, 60%, this exam was made it in order to let you know that you're fighting against pharmacology, and you are learning about pharmacology. So you need to just keep going. Just in the last 2-3 weeks that we are going to have in pharmacology are critical. Why? Because I will tell you something. When Hesse or Encles, they want to make it harder, they want to do psychiatric, and that is what is coming now. When they want to make it mild or moderate, they ask basically diabetes. And when they want to make it mild, moderate, they use, there is no easy one, but mild to moderate exam they do for gastrointestinal. So that is a way that we need to keep going. And I thank you for you coming for this session. Okay. Any comments? Any question? Samna, lady, Cyril,
Dr.
Claudia?
G, thank you.
No question, Dr. G.
No? Okay.
No question, Dr. G. Thank you so much for this. It really helped.
Okay. All right. Thank you. So now we are going to go to the last topic. The last topic is the personal study plan. This personal study plan was I was putting together. There is a lot to talk about personal study plan, but I'm not going to go into details and go around.
Hold on. So who's getting the points?
About what?
We were gonna get points, right, for today?
Yeah. We still having the activities.
Okay.
We still having activities. So the points are updated, but we are going to see in the next few moments when you finish this one. Personal study plan. So time to plan. we are away from HESI very few weeks from now. We are going to have our first test. And that one of the reasons we was doing this activity was that HESI that is coming. So we need to, I'm going to go straight to the point. I know everybody's tired, and we want just to finalize that, but with effectiveness, okay? Effectively done. So we have, number one, study plan. You need to identify, then you make the plan, and then you get it. So 3 steps only. So stick with your schedule. So what does it mean? First of all, step 1, identify, pick up 3 weakest or more difficult areas on pharmacology. Typically and classical, the most difficult topics that they can, if you master this, or you not master, if you know very well this endocrine, psychiatric, and gastrointestinal, by sure there's big, huge chance that you're going to pass your HESI and the correlation with MedSearch. So endocrine, psych, and gastrointestinal. Endocrine is coming. Psychiatric is coming. Gastrointestinal we review. So please review the PowerPoint I post in Moodle. So recognize three things. Step 2, schedule in calendar 6 hours a day for 6 days. 6 hours a day for 6 days twice. So that means 2 weeks. Okay, 2 weeks. 1 day you can rest. So 6 days, 6 hours for 2 weeks. And these 6 hours you divide it in 3 in the morning and 3 at night. For this, I upload this calendar where you can actually put here in this, you can put a line here. We have AM and PM. You can put a line here, AM and PM, and they are going to tell what you're going to put is the time you're going to study. But please, this study time is going to be a effective study time. You sit down a certain hour, that is where you start to memorize, to review, and to recall information. Okay, it's not like reviewing and then this, I like this is after organization. No, don't include organization here. So you need to put your mind perfectly in the study mode. All right, so step 3 and get it. So that means 1 hour, the first hour of the 3 hours, the first hour, AM take practice question 55. So ideally, seriously, is 25 questions. So you can go down to these 25 questions. I put 55 because that is the exam that we have in HESI. And the mini HESI and the exi HESI is going to be sequential over 55 questions. And where are you going to find this? I'm going to put you in Moodle. In Moodle, I'm going to put the after bootcamp, I just say after bootcamp, HESI 1, HESI practice 2, HESI practice 3. I'm going to put you 3 HESIs. You okay with that? Okay? And,
yes.
And that is basically, we are going to have 3 weeks in order to complete the whole material. Of course, I'm not going to check on that. Is who is going to supervise? Yourself. Okay, so you are your own supervisor from now on. If you have a test anxiety, take this practice test standing up or walking. You will not do this in real exam. So, but this distracting or getting you off of focusing is helping you because you're going to be more aware. You're getting stronger to take exam. So anxiety, as we already talked, and you have the PowerPoint, you can review the PowerPoint, is uploaded there, you can read it, and you can detect what are your negative thoughts, what is your mind settings, what is making you change from negative to positive, right? So all these tricks, breathing process, breathing is very important, especially when you're in front of the machine taking the exam, okay? The second hour, so when you're going to do the exam, you write up the missed questions. So this is important, please. So I don't want you to write down all the questions again. Why? Because it's useless. It's not going to take you to anywhere. You need to write down something that is going to help you, to tell you, to remember, or to remark the importance that you need to remember some components of the concept. For example, which words are confused. So please don't overlook. So every single word need to be known. Why? Because in Encles and Hesse they put different words, and you said that word is not important, but it is. It really means a lot. Okay, so please, if you don't have clear what does it mean a word, write it down and look what does it mean. Was there a drug that ever hurt? So actually, yeah. So all these the drugs in this exam, do you see some drugs that you never heard before?
Yes.
Yes.
So those is where we need to those is what we need to go. Okay, so those are the and you need to use your suffix, your prefix. Okay, and the context of the question, they are talking about antibiotics. There's different ways that you can know what is the purpose of that drug. You know what? You're going to take this same exam outside of classroom, of course, with me before the HESI and see what you're going to do. So I'm going to give you please don't copy any question. Don't copy question, because copy question means you are trying to memorize answers, and that is poison. You're wasting your time doing that. So seriously, you're wasting your time. You have the false sensation that you're doing something good, but definitely you're going backwards doing that. So if your intention is, I know the intention is not that, but I mean, that's why we are here to because probably you think that it's good to do it, but it's not good to do it because not because of the I have these questions are not coming from the Q bank for the school at all, or that I have for the school. This I pay my own money. I pay like $75 for this, and I was having all these questions. So, and I did it because of this 75. I don't remember. That was like 1 month ago. Well, do not assume that you know a topic until you verbalize the concept. Is that clear? So when I say something, you start to say just keywords, but here and there, but you don't explain me that. So that means you are more memorizing than understanding. So it's when you verbalize, it's when you know. You said you know the material is when you can explain. No, you know, like a teacher, of course, but you can basically make yourself understand what you're trying to say, right? So that is telling us that you know what you're talking. Is making sense whatever you said. Okay. So when somebody talk wrong or wrongly, it's because the thoughts are wrong. So you're going to talk or say something in relation to what your brain is sending orders to your voice. So if you are in conclusion, if you're thinking right, you're going to say something right. But if you are thinking something wrong that is not clear, you're going to say something is wrong. So that is the verbalization of the concepts. So the second hour, you're going to write the question that you miss. Second, which words to be clear on what you are reading. If you didn't hear in a drug at this moment, you can write it down and start to look for. At this moment, I'm very happy to tell you that you have basically mostly all the drugs that we until this moment, until thyroid and pituitary, adrenal gland. So all the drugs that we have in the past, I'm sure that at least 99% of the 98%, I would say, of the drugs are being already mentioned. So you don't skip it. What is coming is what is in the future, the diabetes and the psych. So in this module, in this pharmacology, we are going to do antidepressants, for schizophrenia and anti-epileptics, and that is a high yield for NCLEX and HESI. Now, in a sheet of paper, use keywords that make you easy to remember the concept. So please, don't try to write down the whole sentence. It's going to be a waste of time. Believe me. Believe me. So it's a waste of time. Just send yourself a message that you're going to understand in the next day or 2 days. So write down something that is going to be reading by you, and you will understand what you're trying to tell. In the third hour, identify again which topics are weak and watch my webinars for specific topics. You don't need to go to my webinars if you don't want it. So you can go to other lectures, other videos that are actually very well done, and they are going to help you in that. In addition to that, you can ask me anytime, anytime. So office hours, more than office hours, you can call me about 11 p.m., 12 p.m., morning, 1 a.m., 2 a.m., please, I'm trying to sleep at that time. So, but for 18 hours a day, you can contact me, and I will be more than happy to help you. And to there's things probably that I don't know. I will investigate. I will tell you. So let's work this together. So I don't want you to feel that you are in your own. That we are watching you very closely, and we want your success. In the PM hour, so that is in the morning. What happened at night? You have 1 hour. The first hour, retake the exam, and yes, retake the same exam, but don't try to memorize answers. And make a check on note when you are confident that you know the material. So yeah, so you start to check out all the concepts that you already know, and try to reinforce the ones who are more weaker. The second and third hour of the night PM time, discuss the topic with classmates. If not, do it with yourself. Talk to yourself. Start to talk to yourself. So a guide, at least talk about the 2 most important nursing considerations for patient safety: side effects, 2 side effects, 2 contraindications, and 2 most important interactions, if that applicable. Not all the drugs are necessary to do the whole thing. Why? Because they're not relevant. So then basically you need to focus on the problems that can produce risk or safety on the patient. Now, how to review? Review, imagine here we have how to review these cases. Imagine that the case are giving you in the exam, just pick up 1, 2, or 3 of them, and imagine that you are in the hospital in that setting, and imagine the patient. So in that case, you in order to reinforce everything and to wrap up everything, you need to think about the patient as a real patient about the exam question. And again, the main complaint, the clinical history, the main complaint, the present, past, family supply, and laboratory vital signs, and the physical assessment. So doing that comprehensive review, I'm sure that you will be very successful in the HESI and the NCLEX exit. Basically, this is the first time that a group is receiving this. It's not like you are responsible to get better. No. So this is a process. This is a process. So everything depends on you, and I'm doing my portion too. So let's work this together. I don't want anybody to feel down in any way, because all of you, without exception, are intelligent, and there are not way you to not to pass the NCLEX. So, but everything depends of you from now on. And the last is what will be the focal assessment? So differentiate between signs and symptoms of the patient caused by disease versus the signs and symptoms of the side effects from the drugs. That is basically what I was telling you, I guess, from the very beginning, from this session. How focal assessment will be if the patient will show unexpected adverse effects. So that is what you need to, and that is basically about clinical. So clinical clinical and didactic, they go hand by hand. So if you do clinical good, you're reinforcing what is the material. So you're going to memorize things. You're going to be able to memorize and to retain and to correlate things more easily. All right, so that's all for today. So I want, if you make a plan for 2 weeks for a study plan, will be nice. And you can do it probably if you are busy doing something, try to do as much closer the calendar I was suggesting. With this, I will like, please, if you can go and have a bootcamp evaluation template for student satisfaction survey. So if you please, I will appreciate very highly if you open the file, fill it up. You're going to upload it in Moodle, and that's all for today. So any comments? How was, just to finish here, just to wrap up here, Samna, how was the whole experience for you? Was okay? Was we need to improve things, I guess, right? Always.
Yes, Dr. G. I really need to improve more. It was really good.
What?
It was really good.
Okay, thank you, Mr. No, Miss Lady. What do you think?
I'm sorry, Dr. G. I couldn't really hear your question. What was your question?
What is your opinion about the whole activity today? Do you want to be repeated or what?
I didn't hear that part. I think it was good. I think it was very, very helpful. I really liked this. It was actually fun, like Fidel said. Yeah.
Okay, thank you, lady. Miss Cyril.
I really like it, Dr. G, because it helps me to prepare what would to expect for the mini HES or for the HES exam. Yeah.
Okay, thank you so much. Miss Claudia.
It was very helpful, Dr. G. Just one comment. For the HESI, is there a way that we can review just to see what we have missed on the questions, on the quiz, or if for the future test that we will have for HESI, if we are able just to review the answers after we take the test, just to see, like, okay, to look at the question from a different perspective, and see what we are missing?
Yeah, the machine is showing you what is the right answer, right?
No, it's not. We're not allowed to review after we're done.
Okay, so I think this HESI is not part of the school, so I going to give you an answer by tomorrow. Okay, so I think I'm going to push to, I want that HESI to be, because it's a tool of teaching tool. So these questions are not coming for HESI. I don't know. Nobody knows what is coming in HESI, mini HESI. Nobody knows. I don't know what is coming. I can suspect, but I cannot tell. But yes, you will have the chance to review that, Miss Claudia. I promise.
It will be very helpful. Thank you, Dr. G. Everything else was great. I feel that after all, this week was very exhausting. We had activities every day. We had clinicals yesterday, and we are.
Okay,
We
so
stayed until 11:30 at the site, and then.
Thank you, Miss Claudia. Miss
Thank
Altia,
you.
tell me.
I found it helpful, Dr. G. I also learned a lot from not just from like everybody testing each other, and also the mnemonic. I also learned from that. The test, I found it a little bit confusing just because some of them were like both answers are both A, B, C, whatever. But besides that, it was a really good learning opportunity. Thank you.
Thank you, Miss Altia. Miss Ruby.
I think it was good, Dr. G. Someone said it earlier, and I think it's a good way to summarize it, that this is a learning experience. And since this is our first time doing it, of course, it's not perfect. We had some trouble earlier, some confusions, but it's normal since we just started doing this, and we'll learn to do better next time. But I really appreciate you doing this. I know this takes a lot of preparation and time, and I think the slides are super helpful too. I'll for sure be looking back to those for reviewing. And yeah, thank you.
Thank you, Ms. Ruby. Thank you. I appreciate your time, your effort. I really do. Thank you. Miss Rebecca.
I really, really appreciated the practice tests. I think that's what helped me more than anything else. Personally, I don't like contests. They kind of give me anxiety. So I would prefer to have more review time instead of contests, but that's just me. But overall, this was a really good experience.
Yeah, I think if we do more of these contests, it's going to give you're going to break the barrier to be anxious for the. Tell me, is there a really reason to be stressed about that, right? So yeah, I respect the way of everybody, right? But I think it's a way that everybody could get use of stress. And thank you. I appreciate your effort and your time, Miss Rebecca. I really do. Mr. Fidel, your comments or NA?
I want to say thank you, class. It was really helpful. The whole questions that we were asking each other. I think it just cleared it up more for me.
Okay. Thank you, Mr. Fidel. Thank you. Mr. Miguel, please.
For Dr. G, I thought this whole thing was very helpful, and I'd also like to say thank you because you're giving up a lot of your own time to give us extra for our own education. So thank you for that.
Yeah, thank you. No, thank you for all of you to come. Miss Kimberly, thank you so much, Miguel. Kimberly.
Yes, Dr. G, everything went smooth and very helpful for everybody. And I thank you for all the effort that you are giving us. And that's all. Thank
Okay,
you.
dear. Thank you. We will see if we can do another one. So just let me know. Everybody's tired. You don't want to sing. So let's wait a few days in order to see if we are going to do a new boot camp or not. Okay, Anila.
Yes, Dr. G, thank you so much. I really enjoyed the boot camp and the practice questions. So thank you for that.
Excellent. Thank you so much. Ismael.
Yes, Dr. G.
So you want to repeat it again? No, right? Yes. Okay.
Yeah, if we can, of course, it's helpful. So I think we need something like this because first of all, it's helping us to know like how to approach a question, like like me, I feel like this was so helpful to me. I just feel like I have more to review, so I'm glad. I just want to say thank you to you for your time, and we appreciate you.
So thank you, Ismael. Thank you so much. I really enjoyed you to be here and be part of the team. Thank you.
Yeah.
Miss Montserrat.
First of all, I would like to say thank you very much, Dr. G, for your time because you should be, taking it, resting and all that, but you've given us the time. Thank you so much. And this is like a wake up call for me, especially when we do the essay thing. It's like I still need to review. It's like I still will to study more. And this is really fun for the boot camp. And thank you so much for everything.
Yeah, thank you, you, Montserrat. I know that you're very concerned about your progress and your development, and I really admire that. So keep going like you're doing, please. Thank you. Okay, Miss Krisa, please.
I agree with everyone, Dr. G. Thank you for all the effort. And like what you said, what you put in, we also put in. It's a teamwork basis. But like what Nikki said, I totally agree with her. This is a wake up call for me regarding the HESI and practice exam. I realized my weaknesses and strength, and like what you said, take those weaknesses and make them a strength.
Thank you. Thank you so much. Thank you, Miss Carissa. Mr. Joel.
Yeah, no, everyone has it correct. What I like is what I see from everyone, kind of this extra drive. I see everyone a little bit more motivated, more committed to studying because we don't want to get complacent. So this is really going to help us. Okay, how much effort do I need to put in? How much work do I need? Where are my weaknesses? Where are my strengths? And work and build from there. That's kind of what I enjoy seeing from everyone, kind of putting their part.
Yeah,
That's what we need to continue.
yeah. I'm very happy, and I need to congratulate all of you about, because this is a process that you. This is a process, and you. Where is my here? Okay, and I'm very happy that all of you are doing. I can see that interest was very spontaneous in some moments, and I really enjoy it. That was a present for me, seriously. To see that motivation make me feel good, but seriously. But it was spontaneously from you. Was not kind of pushing yourself to do something, but it was enjoyable. I thank you so much for that. So let's do the points now and see the final grades. And let's see. The first, besides this is not a winner, and this is not somebody losing. Okay, so everybody was a winner here today. Thank you, Group E, Nila, Miss Sanchez, Miss
Thank you.
Sisai, Mr. Sisai.
Yes, thank you, Dr. G.
Thank you, Miss Claudia. Yeah.
Thank you, Dr. G.
Thank you, Miss Guevara. Thank you, Miss Guevara. Thank you, Fidel. Thank you so much. Cheyenne, so we are missing you. You're not here right now. Montserrat, thank you so much. And Cyril, thank you so much. And Altia, thank you so much for your effort. And the lone runner is Miss Krisa. She was alone in her group. I need thank you so much to come and help us, to help me in some moments about to organize this event.
Not a problem. Thank you.
So the things we are going to do, I told you I'm going to do I'm going to, if we are I need to decide if we are going to have a boot camp, we can do a continuation of the grades. But if we are not going to do a new camp, that is going to stay as it is. And I going to, as I promised, I going to deliver points. And everybody was close. Everybody was close. Nobody was away from each other. So the grades were very, very, very close. So basically what I can tell is that everybody was a winner, even me. I'm a winner because I learned few things from you guys. And just thank you for everything. Okay. All right. I will see you next Friday. And please, please, please complete your survey. That is going to be very important for me. Okay.
Thank
Okay, Dr. G. Thank you.
Okay. So thank you. Have a good night. Bye bye.
Thank
Thank you,
you.
Dr. G. Bye. Good night.
Night.
Thank you, Dr. G.
Night. Mr. Joel, everything is okay?
Yeah, everything's okay. I just want to say thank you. I mean, 8 hours in work and dedication, and we appreciate it. I mean, kind of speaking on behalf of the class, on both class, we appreciate your effort, your work.